नाही म्हणला
अरे म्हणला की
बोलते
मला ओळखीचं सांगायचं
आम्हाला कुठे बोललेलं
जेवलाची
लवडी आहे साक्षीमध्ये आवडलेले असं एकट्याला बोललेलं रे.
बसला असं म्हणलं जेवण आपण
मला मला
Good morning, everyone. Sir, am I audible?
Yes, ma'am.
Hello, madam.
Good morning, everyone. Sir, am I audible now?
Yes, madam.
Okay. Good morning, everyone. On behalf of School of Pharmaceutical Sciences, I am Ms. Sonali Nirankari. Welcome you all for this second day of National Webinar on the fundamentals of research in pharma, organized by School of Pharmaceutical Sciences, Sanjay Godavat University, Kolhapur, under the guidance of Honorable Mr. Sanjay Godavat ji, President of the SGU, Honorable Mr. Shrenik Godavat, Secretary of SGU, Mr. Vinayak Bosle, Trustee of SGU, Professor Dr. Matan Telsang, Vice Chancellor of the SGU, and Dr. N.K. Patil, Registrar of the SGU. Now, moving towards our session, it will be my honor to introduce our today's eminent speaker, Dr. Srikant Pawarji. Dr. Srikant Pawar has done Masters in Pharmacy in Pharmacology in 2006 and completed his PhD in Pharmaceutical Sciences in 2014. He has a total of 15 years of experience in research, education, and training. He has published 13 research papers and presented more than 25 research papers at national and the international conferences. Currently, he is working with the Pulmocare Research and Education Foundation, Pune, as a national coordinator and the head of the department Respiratory Research Network. He is closely working with the Albert Einstein College of Medicine and Montefiore Medical Center, USA, as a co-investigator and a project lead. He is also involved in designing academic research projects in respiratory medicine and the diagnosis and coordinating various projects on health technology. Before joining Pulmocare Research and Education and Foundation, he was working with the prestigious Chest Research Foundation, Pune, on the same profile as the head of the department, Research Respiratory Research Network of India. There he also worked as a project lead for the National Institute of the Health (NIH) USA-funded project in collaboration with the Massachusetts Institute of Technology (MIT) USA. He was associated with the Acutest Research Library at the Clinical Development Services Department. He had successfully guided 25 PG pharmacology students for their dissertations. He was awarded with the Young Scientist Award in 2018 by the prestigious European Respiratory Society at Paris for his research work. Diagnostic accuracy of asthma severity grading using the machine learning features and lung sounds. He also grabbed opportunities to present his research findings on global platforms like Biopharma Asia at Singapore in 2010 and at the faculty of the Pharmacy Conference, Cairo University, Egypt in 2008. He has worked as a scientist abstract reviewer for the International Society for Pharmacoeconomics and Outcomes Research conferences at Dublin, Canada and China, and many more. He is also a reviewer of the Journal of Diabetes, which is the official publication of the Chinese Society and Endocrinology. Now I request Sir to begin with his session. Over to you, sir.
Yeah, thank you, Sonali. Am I audible?
Yes, sir.
Yeah. So thank you, Sonali, for this kind introduction and the kind words. First of all, I'm the staff and the whole management of Sanjay Godath University, who has given me the opportunity to express, my little bit experience in form of this presentation to all the students of pharmacy, those who are pursuing their bachelor's and the master's. So good morning, all. Very warm welcome. So just I will share my screen. Yeah. So is it visible to all?
Yes, sir, it's visible.
Yeah. Just I'm currently working, with the Pure Foundation. So this is again a not-for-profit, Section 8 company where we are doing, research, clinical research, mainly for the respiratory diseases. So I'm a national coordinator and a head for the Respiratory Research Network. So today I have selected one topic that is again related to the research questions. So I think yesterday there was a session on the research questions. So no need to bother here. I'm having a little bit, a different, very simple. But this is of my own experience, how the research studies are designed and how these research questions plays a very important role, in developing drugs and managing the treatment of the patients suffering from various chronic diseases. So in my presentation, I'm going to give more emphasis on how to develop a research question. So again, this is will be with the help of some examples of research studies, which we have conducted, in my previous organization, and also some studies which are ongoing. So very first, to go with the basics, who is need to identify the research question? So generally, the research question is identified by the researchers, those who are working with the R&Ds, the research and development. The research questions are again identified by the, the investigators who are working with the different laboratories. So it may be a government setup, or it may be a small college lab where the students are engaged in identifying some research question, and their main aim is to, submit the thesis to the university and to get award a degree. So generally, the people who are with the research mind, those who want to do something, in the field of the research, maybe it may be the medical, it may be the pharma, but it may be. Yeah, so whether it may be any type of the research field, these research-minded people, they are always engaged in identifying some research questions. So why the research question is important? Yes. Again, to solve the problems of the society, we need to identify some valid research questions. When you are pursuing your bachelor's degree, maybe in the third semester or in the final semester, you have to submit some small project work. And for that project work, again, you need to identify some small research questions so that you can develop a small research study and you can submit your project to the college. For the master's thesis, yes, again, the level is a little bit higher, right? Where you want to understand how the research is, a research question is identified, how a particular research study is designed, how the particular data is generated, how it is analyzed, and then how it is presented. So to understand the basic of the research, right, the master dissertation is very, very important. So when, yes, again, when you are pursuing your master's degree, when you are pursuing your PhD degree, okay, or when you are working in, research lab, right, you need to identify some research questions. Yes. Now, very important question is how to identify the research questions. So if you ask me, the conventional method to identify the research question is to talk with your guide, to take the feedback from the experts in the field where you want to do some research. The literature search, you can go through different databases. You can go through the different websites, right? You can go through your library, which is there in your college, and then you try to identify the research question. So now these are the very conventional methods of identifying the research question. Now, very important is for whom to identify the research question. So who is the end user of the, the outcome of your research? So the research question should be designed by taking into mind the patients. So we are in the field of the pharmaceutical sciences. We are developing some drugs, right? We are doing some QA of those drugs. You are screening the drugs in the pharmacology, right? In the pharmaceutics, you are developing some different formulations. In pharmacognosy, you are extracting some herbal pharmaceutical active constituents, the phytoconstituents, and then you are evaluating it. So all this thing is for whom? So finally, it should be for the patients. No doubt, some research questions are there. They are designed, the study is designed finally to generate some knowledge. So here we can say research for a research. So research question is identified, right, for the next step of research. Whereas some research questions are identified to translate the outcome of the study into the clinical practice. So if you ask me, from my point of view, very important is the end user, that is the patient. If your research, the research outcome, if it is going to benefit at large to a patient, then it will be having its own credibility. It will be having its own position in the field of the research. So finding a research idea. So most of the time, the PG students or the bachelor students, when they are supposed to submit their project, right, they are having their own personal interest. When I was guiding some PG students at that time, the students used to, express their research ideas, their own interest. That, sir, we want to do something in the cancer. Cancer is of my interest. I want to do something in the ischemic heart disease. From my family, my family member, maybe mother, father, brother, sister, they are suffering from the ischemic heart disease. And I want to do something so that I can come up with a new research idea. I can come up with some new treatment which can relieve the pain and the suffering of the patient. So similarly, the students and the researchers, they are having their own interest. And according to that interest, they want to develop a research question. So next is the social interest. So some researchers are there. They want to find the research idea which will directly help to the patients who are suffering from the acute and the chronic diseases. So research idea, right, can be framed, the research question can be framed by keeping into the mind the sufferings of the patients. So it should be of a social interest. And another approach is of a commercial interest. So now there are many startups. You can see in this COVID pandemic, since last year, there are many. So there are many startups, right? They have emerged and they are doing some sort of the research. So they are doing the research for the social interest, As well, there is some commercial interest. They want to gain, some profit out of that, and they want to use that profit to come across with the new research ideas and the new development of some therapeutics and some diagnostic devices. So most of the time, the research question is designed, okay, or the research idea, it comes of your own personal interest. It comes from your social interest that, yes, I want to do something for the society, and this is the problem in the society. And the third is of the commercial interest. You want to become some entrepreneur, you want to do something in the research, and you want to commercialize your own research ideas in the future. So these are the basis of finding the research idea. So now, very important, how to find a research question? Yes. So no doubt, your own research ideas are there. Your guide will give some, the research ideas to you. So if you ask me personally, I will say that yes, first know the burden of a particular disease. Because ultimately, if you are going to develop some formulation in the field of the pharmaceutics, you are going to extract some drug in the field of the pharmacognosy, or in the field of the pharmacology, you are going to screen some drugs. So ultimately, from whom, for which disease you want to, develop your research study. So the research idea, again, the basis is to whom. So for that, we need to understand what is the burden of the particular disease in the country where you are living, like India. Or some people, some students may thought that, no, I want to work on a particular disease which is affecting globally. So there is a global need of some therapeutic drugs. There is a need of some diagnostic devices, or there is some need to develop some sort of solution which will help the patient to manage their disease. So sometimes your thought may be restricted to your country. Sometimes it may be open-ended, and you are thinking about the globe. So for this, you need to understand what is the burden of a particular disease. So now here I'm taking one example of a burden of disease. So this is a data from the global burden of disease, so-called as a GBD. So it is a report, a GBD report of 2019, which is published for India. So if you see the burden of disease in India, as per this global burden of disease 2019 report, ischemic heart disease tops, it ranks 1. After that, you can see there is a COPD, then is the diarrhea, then there is a stroke, then LRI, the TB, lower respiratory tract infections, and the tuberculosis, some neonatal causes, all cause of neonatal, burden of disease, then the diabetes, chronic kidney disease, asthma, cirrhosis. So if you see the distribution of the burden of disease in India, again, I am giving the emphasis on the 2019 report of the global burden of disease. So in India, these are the hot or the priority areas in which I feel the students, the researchers, they should work on. They should, build some research question which will help the patients, which will help, the pharmas. It will help the research community, right, to find out the solutions for the patients. So for me, if I want to design a research question, I will take into consideration the burden, right? So which disease is having a more burden? So clear cut, this indicates that why the burden is increasing. Yes, no doubt we have a lot of medicines which are taking care of these patients, but somewhere these medicines, they are having their own limitations. So it may be its effect, it may be its adverse effects, or it may be the cost of a particular drugs. So somewhere we need to bridge the gap. Somewhere we need to bridge this gap and to decrease the disease burden. So for me, yes, this particular pictorial, the presentation, the slide is very important, where I can divert my research area of interest into the particular disease area where I will develop my own research question. So here, Again, a very interesting, findings of the Global Burden of Disease 2019 report I'm presenting. So here it is an Indian report. Total number of deaths per 1 lakh of all ages and both sexes, that is male and the females of all the ages. Now, if you compare the two part, so one is 1990 rank of the burden of disease and another is 2019 rank of burden of disease. So in 2019, you can see at first position, it is the respiratory infections and the tuberculosis. Second is the enteric infections, cardiovascular disease, which is on the third place, then maternal and some neonatal diseases, which is the fourth cause of overall deaths per lakh in the Indian population. Some other infections, chronic respiratory diseases. So likewise, you can see the top 21 diseases are there, those who are having a highest burden in Indian populations. So now here you can see some lines which are going up and some lines which are coming down in a dotted form, right? So again, it indicates that yes, it is a communicable, it is a non-communicable disease, and the green color, which indicates these are the deaths because of some injuries. Okay, so here you can see from in 1990, from the position 6, the chronic respiratory disease burden, right, it raised to the second position in 2019. Similarly, you can see for the cardiovascular disease, which raised from 1990 from the third position to the first position in 2019. So likewise, here you can see some of the diseases has gone down, whereas some of the diseases, right, they have came up, they have rised up. Whereas some of the diseases, there is some marginal, or slight change. Say, for example, HIV disease, the HIV, which was on a 17th position in 1990, and which raised on 16th position in 2019. So here we can say that, yes, now we have a very good control on the HIV AIDS. Now, if you want to do some in HIV and AIDS, so I will say that, yes, it is a priority, it is a national priority, right? But yes, you can see the top priorities. The lot of research is required in the respiratory area. The lot of research is required in the cardiovascular diseases. The lot of, research is required in the infections. So previously, the non-communicable disease was the priority, right? But now you can see suddenly it has been changed to the communicable disease, right? So you have to take into consideration which form of the disease is on rise. So accordingly, if it is a non-communicable disease like asthma, TB, asthma, COPD, or the cardiovascular disease, then I will design my research question, right, taking into these priorities. If it is a non-communicable, if it is a communicable disease like a COVID, right, then yes, the priority will shift to these communicable diseases. So now again, you can develop in your bachelor's, or even though you are in the master's, because most of the time in the first year of the master's, right, we are blank. We don't know that, yes, what will be my research question in my second year of master's. Or if you are pursuing your bachelor's, right, and you are interested in research, you want to do something in the research, but you are blank, that yes, in which field I should do my research, right? So I think this particular global burden of disease report will give some idea that what are the national priorities, right? So when I'm saying the priorities, that yes, at that time, yeah, the lot of funding is available for these priorities, because these are the national priorities, right? So a lot of national funding, government funding is available, right, for research in these areas, right? So if you're doing your master's, that yes, from the first year itself, you can plan, you can build your research idea, right? You can build your research design, and in the first year itself, you can start identifying those government agency which will fund your project for this particular, research areas. So now this is just a one slide, mainly for the students who are pursuing their bachelor's, to them to understand that when we are designing some research idea, so vaguely, right, or on a broader view, we are having, two concepts in mind that yes, I'm having a drug. I know the structure of a particular drug. Now, I want to identify, I want to see for which disease my particular molecule will have effect on. So here I will call it as a drug-centered approach. That means, again, I'm explaining that yes, I know a particular phytoconstituent, right? I know the particular, from the medicinal chemistry point of view, I know the particular chemical structure of a particular molecule. Now, I'm predicting that yes, because of so and so structure, right, this molecule, right, can show some effect, maybe some, antimicrobial effect against some sort of microorganism. That means I'm having a drug molecule in my hand, right? I will not say a drug molecule, but yes, some sort of, some chemical constituents, knowledge of some chemical constituent is there with me. Now I'm trying to fit into a particular disease. So here, again, it is a drug-centered approach, whereas the another approach is a disease-centered approach, where I know the disease, I'm having a good understanding of the disease, I'm well versed with the etiology, the pathophysiological, all the dimensions of the disease. Now I know the cause, right? Now I want to find out, right, the drug molecule, how I can design the drug molecule, how I can identify a particular drug molecule, maybe from some herbal source, which will have some, good effect on the particular disease. So here I will call it as a disease-centered approach, right? So again, a small example here. I'm having some drugs which will dilate the bronchi, the respiratory tract, so-called as the beta-2 agonist. I'm having some M3 receptor antagonist. As well, I'm having some antioxidants. I'm having some corticosteroids, right? I'm having some lidocaine antagonist with him. Now, I'm having the diseases like asthma, COPD, gastric ulcers, and the COPD. Now, I will try to see this type of the drugs is more suitable for which type of disease, whether it is suitable for gastric ulcer, whether it is suitable for the diabetes, whether it is suitable for the asthma or COPD. So now, with your help of the particular molecule structure, with the help of your understanding of your sound knowledge of the pathophysiology of a particular disease, right, you have to see where your molecule fits properly. Now here, all these drug molecules, they fit, right, for the treatment of asthma and COPD, right? More to the COPD, yes, and to the asthma. So here I will call it as a drug-centered approach and the disease-centered approach. So you have to design your research question by keeping either a drug molecule, right, or maybe a phytoconstituent, right, in your mind, or a disease in your mind. So you can develop your science, the knowledge of a science on the drug molecule aspects or on the disease, on the pathophysiology, right, on the burden of the particular disease. So you have the two approach in your hand. So now it is up to you that whether you are interested to develop a new molecule, right? So medicinal chemistry, I will say, right, is the best approach. Also the pharmaceutics, where you will try to, develop your own drug delivery systems. So it may be, the liposomes, it may be the microsomes, it may be the nanosomes, it may be the targeted drug delivery systems, right? So you can, develop yourself, in the field of the medicinal chemistry and the pharmaceutics, where you are working, exhaustively on the drug molecule, or you can develop your, science from the pharmacology, from the pathophysiology point of view, where you will develop a sound understanding of a particular disease, so that in future, right, you can, develop some drug molecules and you can screen for a particular disease. So now, one simple question I'm going to ask to you, that yes, whether only the researchers, right, like the student who is pursuing his master's, pursuing his PhD, or some researchers who are working with the, research laboratories in the R&Ds, whether they can only find the research questions. Yes. So your answer, maybe yes or no, you can put, your answer in the chat box. I will be happy to see your answers in the chat box. Yeah. Yeah, sorry. So the answer is no. Okay, anybody can develop a research question, right? So yesterday, I think in the lecture of Dr. Ambode, he has given a very nice, he has shown a very nice slide of a baby sitting in front of a laptop, right? And he is playing with the laptop, right? So he's an, empty-minded, child, right? He's not a researcher. He don't know A, B, C, D, right? I think he is unable to, predict that what is A, what is B, or what is that picture. But he's happy seeing some pictures on the screen of the laptop, right? Likewise, the lay person, right? Lay person means a person who is working, in maybe at the grocery store, the person, right, who is doing some tailoring job, right? Or right, your family member, right, who is working in some accounts department doing some clerical job, right? Even though they can help you to find a valid very important research question of interest of the patients, right? So here I will justify this by taking one example of development of pressurized multi-dose inhaler, right? Or just here I will say a pressurized inhaler. So these inhalers which are used, right, in the treatment of asthma and COPD, right? So these are having the drugs which are bronchodilators and which are having the corticosteroids in them, which will decrease the inflammation, right? So these inhalers, right, the pressurized inhaler, right, it was developed by a non-science girl, right? So again, a small girl, right? She identified a research question, and now you can see this pressurized mature dose, right? It is very, very helpful for the patients who are suffering from asthma and COPD to manage their disease, right? Recently, if you can see, right, these inhalers, they are playing very important role in managing the COVID patients, right? The drugs like budesonide, right, cyclosinide, right? So these drugs are available in this, inhalers, right, in the pressurized meter dose inhalers, right, which decreases the inflammation. So how these research questions came up? Now, this is a very interesting story. Without taking up much more time, I will tell you this story. So a small girl, right, so-called as Susie Mason, she was a daughter of a George Mason, right, who was a president of Liker Laboratories, right? Restless with her asthma, right? And now I'm talking, right, this incidents which happens in, around, 50, 60 years back, where at that time, a glass bulb nebulizers were available, right? So just like the BP apparatus, right, which has some bulb, a rubber bulb, right, which is used to generate, the air pressure into the sphygmomanometer. Similarly, here on the screen, you can see a nebulizer, right? So here, again, the reservoir is there, the glass tube is there, where again the drug, the bronchodilators are filled, right? And here again, the aperture is there. Here again, you can see the picture where the patient has to take the whole set, the tool, in front of their nostril, right? He has to open their, again, the nose and the mouth, and they have to spray it, right? But again, what is the problem in this, right? The problem was the patients were not receiving the desired dose which is required to control the asthma attack. It was not possible for the patient, right, to inhale the entire amount of the drug which was coming out of that particular nebulizer, right? So this was a huge problem. The patients were unable to control their asthma, and they were going into the exacerbations, and there were increase in the deaths, right? So this small, the girl, she was routinely facing this problem, right? Once she was using hairspray, right? So she was managing her hair by using the hairspray, right? And during the, using her hairspray, idea came in her mind that whether this hairspray can be used, right, to deliver my drug. Now see the research question. Now this is what I can say, a very outstanding research question which came into the mind of Susie, right? So this was the genesis, right? This was the incidence, this was the thought process, this was a thought idea from where the pressurized meter dose inhaler was developed, right? So she was not a scientist, right? She was not a researcher pursuing her formal degree in the field of science, right? But this was the practical problem what she was facing, right? So she was using a glass nebulizer, which was very difficult to handle, right? Again, she was not getting the appropriate dose, what she was looking for, and she was unable to manage her disease. At the same time, she was using a pressurized hairspray, right? So you can see, the thought process where her observation was very important. And she asked a question to her father, right? Dr. George, that yes, daddy, why can't these people, the manufacturer of these nebulizers, right? Why can't they put my asthma medicine in a spray can, like they do for a hairspray? So whether it is possible to put my drug of asthma into a hairspray where I can use this hairspray to take my inhaler, to take my drug, right? So again, this was a research question, right, which came into the mind of a science background girl, right? Again, I will call him, as a lay person, right? And there was a thought process which was taken ahead by her father, Dr. George, and he developed a pressurized meter dose inhaler. So here, the research question came out through a simple observation, and it was a need of a patient. So whenever you are developing a research question, or whether you want to develop a research question, please keep two things in your mind, right? That yes, it should be useful to the patient, right? For this, what is important is your observation. So as a researcher, right, you should develop, right, ability, right, to observe things which are happening in your surroundings, right? Not only which is given in your books, not only, which is taught by your teachers, by your guide, right? But when you are, walking into the society, yes, when you are chatting with your family members, right? As a researcher, you should, right, observe. Your observation should be very, very keen, right? You have to understand the problem, right? So whenever you will develop this attitude to understand the problem of the patients, to understand the problem of the society, I will say automatically the research questions will develop in your mind. No need to go to the library, no need, right, to take the lot of books, the old books, and again going through those books and to find out the research question, right? To find out the research question, I will say go into the society, talk with your patients, right? And again, understand their problems. When you understand the genuine problem of the patient themselves, they will tell you about the research ideas, right? And then you can take it ahead in a scientific way. Now, so again, as said, your research question ultimately should be to solve the problems of the patients and the end users. So how you can develop a research question? In which different areas you can develop the question, right? Not necessarily that each and every time you are working on a drug molecule, because it may happen that the particular candidate, the student, is not interested in the chemistry. He's not having a very good organic chemistry like me, right? He's not having a very good, knowledge of chemical reactions, right? But he want to do some research, okay? So here, instead of going the drug design, right, you can develop, right, some tools. If you are very good at the statistics, you are very good at the technology, right? Yes, definitely. There is a scope for the research. If you ask me in the bachelor's, most of the students ask me, sir, I'm having a very poor mathematics. I'm having a very poor organic chemistry, but I want to do something in the research. But whether it is possible for me, I have heard that to do some research in the field of the pharmacy, yes, I should, learn the organic reactions. I should know what is the particular QSAR, what is the SAR, but I'm very weak, but I want to do some research, right? I will say that yes, it is not a barrier, right? Yes, you can develop your knowledge in the field of statistics, right? You can develop yourself, right, in the field of technology, right? A little bit science is important, no doubt. A sound understanding of particular disease is important, right? In the clinical research also, yes, you can develop, you can find out a lot many research questions, right? So for a patient, what is important? For a patient, the prevention of the disease is important, diagnosis of disease is important, and the treatment of disease is important. So whenever you are developing a research question, right, you should take care of these three important factors. Whether my research question will help the general population to prevent themselves, right, from getting a particular disease, or whether my research question will help the patients, right, to help control their disease, to manage the disease. Whether my research question will come up with the research ideas where they will help in the proper diagnosis of a particular disease, or whether my research idea will come up with a novel drug treatment, right? So on these three different areas, right, your research idea should be concentrated. Whether you are developing a new molecule in a pharmaceutics, in a new formulation, right, it should be useful to the patient. Okay. So here I have taken some example of prevention, right? So we are talking about the prevention, diagnosis, and treatment, right? So prevention of asthma attack, right? So I have taken one example, right, where a company, right, now not many companies, rather not a single company, they are working, right, in prevention of, right, the asthma attack, mainly in this COVID era. Now, in the COVID era, right, all the hospitals are full with the COVID patients, right? So the patients who are suffering from the other diseases, like asthma, COPD, diabetes, right, the cancer, right, they are unable to visit to their doctor. They are not getting their treatment properly. Their follow-up visits are missing, right? So now this is a very important need of an hour where, right, a telemedicine, right, or home-based management of the disease is a priority, right? We need to develop some solutions where these patients, here I have taken the example of the asthma patients, right? They can manage their asthma, right, from their home, right? The doctor, they can have a control over the patient by sitting in her own clinic, right? So now this is a research question for me. If you ask me that, yes, how to monitor the asthma patients, right, in COVID-19, right? So now this is the research question for me, right? So here I've taken an example where a particular company, a UK-based company, they have developed a tool, so-called as the smart asthma tool, right? So here you can see a mobile phone is there, where they have developed a mobile application based on the machine learning algorithms, so-called as an artificial intelligence, right? And here you can see a device which is there in the hand that is called as a peak flow meter, right? So a patient, he has to blow from one side of this particular peak flow meter, and he is able to measure how much amount of air he can take out from his lungs, right? If he's a normal, then he will exhale, right, more amount of air. If some sort of obstruction is there in the lungs, then the less amount of air will come out, right? Now this particular device, so-called as the peak flow meter, it is synced with right, with the help of the Bluetooth, it is synced with the mobile phone where the mobile application is developed, right? Now, this study has been validated, right, across the Europe and the Germany, right? They have done many clinical studies, right? And now I think soon it will be available in India also, right? So where this is given to the patient. So patient is sitting at his own home, right? He is blowing from this particular peak flow meter, and the data is generated, which is shared, right, on the mobile of the doctor, right? And now the doctor can manage, he can see the medical condition of the patient, right? So here it is, the device is called as a peak flow meter. It measures the amount of air which is coming outside of the lungs, right? It records the amount of, the blows, the amount of air which is coming outside. It is generally measured in ml. So it is having a everyday tracking of your lung capacity of removing the air outside of your lungs. Again, it is also capturing the symptoms. The patient, through this app, right, he can, feed the data of the symptoms, what he is facing, right? So from the amount of air which is coming outside of the lungs, the symptoms, right, this particular mobile application, this device, again, with the help of the, artificial intelligence, right, it will tell you, right, that tomorrow your condition will be worse or it will be normal, right? If it is going to tell you by the prediction, if it is going to tell you that yes, tomorrow there are the higher chances of getting an asthma attack, then immediately you can start taking the appropriate drug treatment, right? So called as the rescue inhalers, right? Which are generally taken when the condition is not so much good for the asthma patients, right? Also, this device is going to help you to plan your asthma management, so called as an asthma action plans, right? So from your symptoms, from your lung function, lung capacity, it is going to predict that whether you are going to face an asthma attack in near future or not, right? So see, by sitting at a home, right, the patient can manage, right, their asthma. Now, if you ask me, it is a need of an hour. This type of the devices are highly needed, right, for the doctors, for the patients, again, to manage the particular disease, right? So now this is a very good research question, a very good research idea, right? That whether, now this is an example of an asthma, right? But for the other disease, whether it is possible that the patient sitting at his home, right, giving all the information about his health to the doctor, and doctor from his hospital, from his busy schedule, how he can help the patient who is sitting at his home, right? So here, this type of the app, they use 24/7 services, or I can say and hold on the patient health condition. Now, this type of devices, they are having a very good accuracy, right? Up to 90%, they can predict your lung function. Thereby, you can see almost 48% of the patients, they can control their symptoms, right? And 57% of the patients, they have shown to reduce their emergency visit, hospitalizations, right? Because of this particular device. Now, the another example, which is again based on the artificial intelligence, right? So again, this was a need of an hour. The research idea when the COVID-19 was there, right? Again, everybody was, worried about that, yes, how I can diagnose the patient, right? Because many kits were not developed, right? The molecular kits were not available. The assays were not validated, right? So some researchers, they started working on the artificial intelligence. They started working on the machine learning algorithms, right? So here I have taken one example of the thermal image. Now see the research idea, right? The thermal image, that means your skin temperature, right? How this skin temperature, the thermal image, it helps the doctors to identify that whether the patient is suffering from a pneumonia, right? Or whether it is having some sort of, a normal fever because of some other, bacterial infections. And what is the severity of that particular infection, right? So a lot many researchers are still working on that. So here I have taken a small example that, you have a group of the patients, like patient 1, 2, 3, 4, 5, right? They're having some cold and cough, little bit throat infection, right? So their thermal image, the chest image is taken, the X-ray images are taken, maybe tomorrow the HRCTs are taken, their score is taken. So all the information, the medical history, the clinical history, sign, symptoms, X-ray information, HRCT information, all this data is fed into an machine learning algorithm. So what we call it as the artificial intelligence, right? So again, it is a statistical tool. So all the information is clubbed together to develop a machine learning model. And this particular machine learning model, the artificial intelligence, will help you to know that, yes, the patient, right? Like patient number 1 is a normal patient, right? The patient number 2 is suffering with pneumonia. Patient number 4 is a normal patient. So this type of the, research will help to differentiate between the patient who is a normal patient, the patient who is having a pneumonia, right? So likewise, you can also understand what is the severity score of the particular patient, right? So just by taking a thermal image, the chest image, right? Again, it will give a lot of information about the particular patient. Again, the patient, if it is having a, he's a normal, or whether it is having the viral infection or a bacterial infection. So again, this was a need of an hour, right? So it is again a contactless diagnostic tool, right? A diagnostic approach. So another example I have taken here, which is of a diagnosis of asthma and COPD. Now this is of my own experience. So we have worked on a particular project in my last organization, that is the Chest Research Foundation, right? Where a research question was to develop a diagnostic tool for the diagnosis of asthma and COPD. But before that, we need to understand what was the research question, why we felt that, yes, a diagnostic tool is required, right, for a proper, accurate, fast diagnosis of the patients who are suffering from asthma and COPD. So just we'll try to understand the problem, right? Because based on the problem, right, the research questions are designed, the study is designed. So in India, about 97% of the patients who are suffering from the COPD remains undiagnosed, whereas 60% are misdiagnosed. Means what? Undiagnosed means they're having the signs and symptoms, right, of COPD, right, but they are not diagnosed, right? The doctor, right, who is not well trained, right, they will label the patient that, yes, the patient is having some throat infection, so we'll prescribe with the antibiotics, we will prescribe with the cough syrups, right? The patient will get little bit symptomatic relief, but again, after 15 days, 1 month, the patient will come to the doctor saying that, again, I'm having a lot of cough, and there is a lot of, mucus, and this, sputum is there early in the morning, right? And 60% of the patients are misdiagnosed. That means they are not diagnosed. They are diagnosed with some, upper respiratory tract infections, right? They are diagnosed with some other bacterial infections, right? So they are misdiagnosed, right? Regarding the asthma, 70% of the patients, right, they are having the misdiagnosis, right? And 25% of the patient, they sometimes even know that they are having, asthma, right? So there is a problem in India with the proper diagnosis of this obstructive airway disease, that asthma and COPD. So what is the challenge in front of the general practitioner? So I'm talking about the general practitioner, right? A doctor, who is not well trained, who is not a chest physician, who is not a pulmonologist, well trained, right, for the diagnosis of the respiratory diseases, right? The general practitioner who is practicing at a small village, right, at a rural village, right? So he's not well trained, right? So now he faced challenges to detect that whether the patient is the asthmatic patient, or whether the patient is a normal patient, he's not having any obstructive airway disease, or the patient is an asthmatic patient, right? So, most of the general practitioner, all the doctors, right, they will use the stethoscope, right? They will put the stethoscope on the chest, they will listen the lung sounds, right? and from that, right, they will try to diagnose, right? But for most of the doctors, right, the general practitioners, those who are not well trained, right, for them it is a challenge that only from the lung sounds how to say that the patient is a COPD patient or the asthma patient, right? Or also sometimes with the taking the history also, right? So the diagnosis is the problem. If you see the tools which are available for the diagnosis of asthma COPD, so-called as the spirometry, this tool is very expensive, right? Then all the doctors, all the facilities, they are not having this tool, right? Spirometry to measure the lung function of the patient. Expert technicians are required to perform this particular spirometry, the test, right? Again, it is also very difficult for the untrained practitioner, general practitioner, to interpret the test results, right? So most of the time they are unable to interpret the test results also, and thereby they are unable to, come to the final diagnosis. So here, what is the problem? Problem is with the diagnosis. So diagnosis is not happening properly, right? So again, whether we can design a research question, so whether it is possible to develop a diagnostic tool which can be used by untrained healthcare worker or a doctor, right, who is doing the practice at a remote area, a small village, right, where I think the electricity is also not there, right? So like ASHA workers, the remote places for the preliminary diagnosis of obstructive airway disease, right, where spirometry tool is not available, or even the doctors are not available. So this was the research question in front of us, right? So whether we can develop that diagnostic tool, right, which can be used by the ASHA workers, right? So they can go to every home, and they can at least have some preliminary diagnosis that yes, this patient is not a normal patient, he's having some sort of obstruction. Now that ASHA worker can refer that particular patient to a doctor, right, for the proper diagnosis and treatment. So this was the research question in our mind, right? So we tried to develop a diagnostic tool, right? So we undertook a research project which was funded by National Institute of Health, USA, and this was in collaboration with MIT, USA, right? And this study was done at Chest Research Foundation, right? So there was a collaboration between the CRF, Chest Research Foundation, and the MIT to develop this diagnostic tool, right? So for this, right, a proper study was designed. So no doubt now we have a research question that yes, whether we can develop a diagnostic tool, but now to develop a diagnostic tool, right, what else is required? How we will develop a research, a study design to come to the particular outcome of the study to get a diagnostic tool, right? So we design a questionnaire which collects the information about the medical history of the patient, the signs and symptoms, right? We used the peak flow meter. We used a smart stethoscope. In next slide, I'm going to show you, right, how a smart stethoscope was developed, right, by the MIT, USA. Then the thermal image camera, how the thermal image camera we use again to diagnose the patients, how the X-ray information was used, how the lung function test like impulse oscillometry, again it is a device, right, which measures the resistance in your airways, then body plethysmography, DLCO, spirometry, right, then blood test, sputum test, how the information of all this test was used. So we developed tree, right, where you can see where we collected the lung sounds of the patients. We classify the lung sounds of the patients depending upon the type of the lung sounds, whether it is a wheeze, whether it is a crackle, which type of the lung sound is there, right? Then we, sync the data with the peak flow, how much amount of air the patient can take out, right? Then we collected the information from the lung function test, all the devices, right? The questionnaire information was mixed. So with the help of the lung function, with the help of the peak flow, with the help of the questionnaire, right, we developed a machine learning algorithm, right? So machine learning algorithm, that means we have collected lot many data for, say, for example, around 200 patients data. We, develop an algorithm, right? And thereby we developed a machine learning algorithm, so called as a diagnostic kit, right? And this kit is now ready, right, to at least differentiate between the patients who are suffering from asthma, COPD, or any other obstructive airway disease. So now here you can see, right, how the research idea was developed. So again, the need was the driving force behind this research idea. Okay, so we developed, the smart stethoscope, right? So here you can see the diaphragm is there. So a microphone is placed in this stethoscope. Now this stethoscope is attached to the mobile phone, right? Now this, in the mobile phone, no doubt we have developed the algorithms, right? The mobile application is again developed. Here you can see the sound waves, right? So this stethoscope is placed on the chest areas, on the thoracic cage, on the anterior and the posterior side. The stethoscope, the diaphragm is placed, and the patient is asked to inhale and exhale. So when the patient is going to inhale and exhale, right, these sound waves are again recorded, and then at MIT, right, they do the sound classification, sound analysis, and thereby they develop the machine learning algorithms, right? So which type of the lung sounds were there, whether they were wheeze, crackles, or the lung sound is normal, depends upon that they develop the machine learning algorithm. So Chest Research Foundation was engaged in patient recruitment, right, designing of the study and the collection of the patient's data, the lung sounds, whereas all the, the technical, the sound analysis, the machine learning algorithm, it was done at the MIT lab. Okay. And the accuracy was very good. It was around 70 to 80%. Diagnostic accuracy, that means 70 to 80%, this particular device can differentiate between the normal patient and the patient who is having the obstructive airway disease. Right? So now you can see, right, a tool was developed for the diagnosis. Okay. So now again, I will take an example. What was the basis of the research idea? Practically, right, in a research group, in a research, what I can say, laboratories, right, how the data is generated, right? So most of the time, right, only the drugs invention or the, discovery is not important. So most of the time, right, the data itself, it plays a very important role, right? So you can develop a research idea to generate a data which will guide, which will help to generate the future research ideas, right? Now here, I will take a simple example through which you can understand how the data itself, right, can help to generate the further research ideas and will help to develop the treatment and how it can change the policy of the clinical practice. So here I have taken the example of bronchiectasis. So what is bronchiectasis? So bronchiectasis is nothing but a disease which is related to your respiratory system. So in this, right, there is a permanent damage to the airways, right? So bronchial airways, right, they are permanently dilated, they are widened, they are thickened, right? So again, you can see the patient is unable to breathe properly. Now, if you see, in India, bronchiectasis is considered as a rare disease, right? But in spite of that, not many patients were there who were, right, suffering from this particular disease, right? It was considered as a rare disease because no sufficient information was available. Individual, right, in India, doctors were saying that, yes, I'm having some bronchiectasis patients. I'm having some bronchiectasis patients in north, south, east, and west, right, across India. But, right, no sufficient data was available to say that, yes, whether there are, enough patient in India. If yes, then how to treat this patient? What should be the treatment, line of treatment, right? Whether there is some agreement in treatment, in deciding the line of the treatment. Then what are the diagnostic approach, right? So there were many questions, right? Which age is suffering from the bronchiectasis? What is main cause? The etiology? What is the pathophysiology behind this bronchiectasis? So, right, before we did this study at Chest Research Foundation, right, in my department, that is the Respiratory Research Network, right, in India, no idea, no data was available, right? So no sufficient information was available for the treatment of this type of the patients, right? There was no consensus. The doctor who is from the north, he was treating the patient by his own clinical judgment and experience. The doctor who is in the south, in east, west, right, they were, having their own problems, challenges, right, in treating these patients, right? So this was a need of an hour, right? So again, the research idea came into the mind, right, that whether we can itself, very first, we can generate a data which will tell us that how many patients we have in India, what is the etiology, what is the pathophysiology rather, right? What happens in the bronchiectasis? What are the main causes behind the bronchiectasis? Which age group is more affected, right? Exactly in the bronchiectasis, what is happening? Which lung lobe is more affected? What are the phenotypic characteristics of this particular type of the patients, right? So there were a lot of research questions, right? Now to answer this, the idea was generate to have a multi-centric study, right, to generate a data, right? So with the help of an European bronchiectasis registry, right, in India, Chest Research Foundation, right, with the department, that is the Respiratory Research Network of India, India registry was developed, right, again to generate a data. And this outcome, the results of the data, it is published in a Lancet Global, a highly reputed journal. So now this is the very, what I can say, very important journal, very important publication for the bronchiectasis, at least in India, which answers most of the questions of the doctors and the researchers. Also, yes, for those who are working in the drug discovery and the development. So now here you can imagine, just merely by generating a data, right, how we can find out the challenges, what are the challenges, right? And based on these challenges, how we can design, right, the future research ideas, how we can, design, we can change our approach in the drug discovery, treatment, management, diagnosis, right? And, clinical practice for this bronchiectasis patient. Now here, just I will show you one outcome. So when this data was analyzed, it was observed that the main causative factor for the bronchiectasis was the tuberculosis. Yes, so it is a very interesting finding that out of 100%, right, the patients were suffering from the bronchiectasis, 35% of the patients, right, their underlying cause was the tuberculosis, right? So the patients who are suffering from the tuberculosis, those who have the history of the tuberculosis, these patients, right, they might develop the bronchiectasis in the near future. They might develop some sort of obstruction in their airways in near future, right? So this was a very important findings which came out from this particular study. So this is only just a small, I will say just one finding, the important finding what I have shown. If you go through the research paper, you will come across different findings which came out of this particular study, right? So this particular findings, this particular study helps, right, different researchers from the drug discovery and development, different pharmas, right, different researchers, doctors, right, to design, the new studies to find out the questions and thereby the solutions, right? So the data which was generated was important for, the researchers, doctors, and the different pharmas, right, to develop new drugs and some new drug delivery systems. Okay. So again, the one more example here I'm taking of one of the study, very simple study, but see the research idea, very, very important, right? So again, I'm saying that a need-based research idea is important, right? No need to, again, go into very deep into the, science, and again, do some lot of, brainstorming, and to come up with the research idea, right? Again, I'm saying that if you see what are the practical problems the patients are facing, the practical problems which doctors are facing, right? So as a researcher, even though you are a pharma student, right, you should talk with the doctors. You should talk with the patients, right? Then and then only you will understand what is their problems. So based on that simple problem, right, you can develop your research idea. So here again, I'm showing one example, a study, which is again very important study, and which is ongoing study in my department. Yeah. So this is again related to the eosinophil, right? So eosinophil is one of the marker, very important marker, right, for asthma and COPD, right? So the systemic level of these eosinophils is increased when there is an asthma, when there is an uncontrolled asthma, right? So it is a biomarker, right? So when the patient is taking regularly his asthma treatment, right, which is generally the anti-inflammatory agent like corticosteroids and the bronchodilators, right? When the patient is continuously, routinely taking his asthma treatment, you will see a well-controlled eosinophils, right? But if he's not, then you will see the increase in the eosinophil count. Now, this was not a research question. The research question was something different, right? So research question was, what is the normal range of eosinophils in our Indian population, right? So this study was designed, by our director, the eminent researcher in the field of the respiratory medicine, Dr. Sandeep Salvi, and the another researcher, that is Dr. Rajadhar, right? So again, these are the top researchers in the field of the respiratory medicine in India. So again, after a brainstorming, right, and with the help of their clinical experience, right, they come up with this research idea that whether we can have, and we can collect a data which will tell us what is a normal eosinophil count in our Indian population. Excuse me for a while, I'm having my battery draining out. Just I will put it into the charger. Yeah. Yeah, sorry for the interruption. So this was the research question, right? That whether we have our own eosinophil base range in our Indian population. Because for the treatment of asthma, we are referring the eosinophil range of, Europeans or the developed countries, right? Their eosinophil count is different. The normal eosinophil count is different. In your Indian population, the normal eosinophil count is different, right? So there is a hell of difference in the normal range. Why it is so? Because in our
Good morning, delegates. This is Dr. Abhinandan Patil. There is some network issue. Because of that, we have lost the connectivity with the guest. But within that time, if any delegates are having doubts related to the current session or the previous day session, they can have discussion here. So the platform is open for the discussion to each and everyone. So they can share their experience, or rather they can ask the questions to the respected guests who are present on this platform. So delegates, you can unmute and you can share your experience or you can ask your questions.
Hello, sir.
Yes, Ishwar.
So can we have a mini coursework on the research?
Sorry.
Can we have a mini coursework on the research?
Okay, so this is a nice concept which is asked by one of the student, that can we have an mini coursework for the research, so where the students can get benefit related how the research can be conducted. So this is a nice idea suggested by one of the students. So we'll take it into our account. And
Yeah, hello.
okay, sir. Okay, sir. You can start with the session, sir.
Yeah, we can start with the session, right?
Yeah, sir. So just
Yeah,
a second. I just will make you a post so that you can share the screen.
Yeah, please.
Yes, sir. You can share the screen, sir.
Yeah. Is it visible?
Yes, sir. It is visible.
Yeah. Yeah. Sorry, audience, for the interruption. Yeah. So here we are talking about some eosinophil studies. Hello. Yeah. So what was the research question? That to evaluate the drug treatment, that whether our treatment is effective, right? We used biomarker as an eosinophils, right? But what is the basic problem, right? We have some cutoff range, right? In Indian population, the cutoff range is very high because in India, right, we have parasitic infections, right? In our stomach, you will see almost in every Indians, right, we have some sort of parasitic infection. Some worm infections are there. And because of that, there is, increased in the level of eosinophils, right? So our cutoff value is high, right, on the higher side as compared to the Western population, right? Now, if I want to check, right, what how this particular drug treatment, right, told the asthma, right? Simply here, the problem is that if you see eosinophilia, right, the eosinophil counts are much higher. Now, if I want to study the effect of the drug on the, asthma, as a biomarker, I will check the level of the eosinophils, right? But if there is a 5% drop, I Am I audible?
Yes, sir. You are audible.
Yes, sir.
Hello, am I audible?
Yes,
sir. You
sir.
are audible.
Hello.
Yes, sir. You are audible, sir. You can continue, sir.
Yeah, hello. Audible?
चालू झाले सर, त्यांना काहीतरी त्याच्या साइडनं नेटवर्कचा इश्यू आहे वाटतं सर.
Yeah. So here we were talking about the eosinophil range. So research question was designed to know the baseline values of the eosinophils for the Indian population, so that based on that we can decide whether our drug treatment is effective or not, right? So this is very important when the biologicals will come into the pictures, right? So again, the simple observation and the need-based study is very important. So as a researcher, to design a research question, what is important is the good observation. So you should have a very keen observation when you're in your college, when you are in the society, when you are speaking with the doctors, when you are speaking with your patient. Very important, again, you should have a very sound scientific knowledge in the area where you want to develop as a researcher. Very important is a multidisciplinary approach, that even though you are a pharmacist, even though you are developing, some formulation in pharmaceutics, or you are extracting some, phytoconstituent from the herb, right? You should speak with the different peoples, right? You should speak with the doctor, you should speak with the patient, you should speak with the engineers, right? So that you will have a different, research ideas. Very important is with a part of the research team. If you are sitting in a corner in a lab, if you are sitting in a classroom, you are sitting in a library in a corner, and you want to now develop a research idea, I will say it is very, very difficult, right? Otherwise, I will say it is very impossible as such, right? So you should be a part of a research team, right? So when you talk about research, research is not driven by a single person. It is a teamwork, right? So it is a team activity, right? So you have to discuss your thoughts, your concepts with your peer group, right? With the different people of the different, disciplines, so that you can develop a very strong research idea. And again, as said, very important is a need-based studies, right? Please undertake a project, research, right? Develop a research study which will help the patients, right? It should not happen, right, that you have extracted some plant extract, right? You have, done some animal studies, you have submitted your thesis, now nothing is there, right? You have spent a lot of money on that. You have spent, you have taken the life of the animals, but what is the next? Nothing, right? So there should be some outcome of your study, right? So design a very small study, right? Design very small study, but see its impacts, right? There should be some sort of impact, right, on the patient, okay? Or it should generate a data, your study should generate a data which will, help the next researcher or the community of the researcher, right, to develop the next step of the research. Very important nowadays is a commercial approach. Yes, what is wrong, right? If you are going to develop a diagnostic tool, right? If you are going to develop your own drug, right? Patent it, right? You can have your own production, right? So for the commercial approach also, very important is the research idea. Unless and until you are not having a, unique idea, yes, no one is going to, entertain it. If you apply for the BIRAC, if you apply for the BIRAC funding, the BIRAC is also asking you that, yes, whether there is some commercial, approach of that, whether you can, scale, right, your research, right? Whether there is some scope to, amplify your research. If tomorrow if you have developed a tool, right? Whether in future you can develop thousands of that particular tool. What is the cost, right? Whether it is cost economic, right? So the application of your research, the application of your outcome of the research, and the scalability is very important. So while designing the research theme, the research idea, research design, please keep in your mind that what is the application of your research, right? So the research question should be designed by keeping all these aspects in your mind. So again, when you are designing a research question, you have to identify the need of the patient or the shortcomings of available treatment and the technology, so that by considering all these things, you can develop a research question. When you are having a one-line research question, prepare a concept note on base of that, right? Then connect with the experts, discuss the concept note, right? raw ideas with the research group, right? With your guide, with the team of the researchers nearby, right? Again, I'm saying, please keep an interdisciplinary approach, right? If you are extracting some plant phytochemicals, right, and you want to do some research, please be in touch with the Ayurvedic, practitioners, right? Be in touch with the patients, right, who are taking the Ayurvedic drugs, right? So they will give you a lot of ideas, right? So very important is the different group of the peoples. Then develop a proper, well-structured protocol. So your study design should be flawless. You have to take into consideration what will be the controlled bias, what will be the uncontrolled bias. If I'm going to particular study in this way, what are the bias? What are the different sources of bias, right? Where I can control the bias, where I can't control the bias, right? Because when you're doing some experiments, some things are under your own control, right? You can control the bias, right? But most of the time it happens that you can't control the bias. Getting the point, right? So you have to all in a proper way. And very important is the budget. Your research question is very fine, right? But again, it requires a high budget. The budget is very high. It is not possible for you to manage it in your college level, right? Then what to do? That's why I'm saying, when you are in the first year masters, or when you are, you have designed your research question, start working on the budget also. That means who will fund you, right? So start approaching the different funding agencies, start speaking with some pharmaceutical companies, right? Whether they can fund through the CSR to your project. Nowadays, many pharma companies, they are, funding to the CSR. Only the clause is that, you should be affiliated with some government research organization, right? So be in touch with these stakeholders. They will fund your project, right? If the concept is very good, if it is having some commercial outcome, and if it is of use to the general population, right? Then check the feasibility, obviously, that whether it is possible. Research idea is very fine, but I'm not having the patient of that particular group. Then what is of use, right? So check the feasibility. If it is possible, then do a pilot study, right? Do very small study, right? Don't go for a higher study because you don't know the outcome, right? Don't know the outcome. Do the pilot study, learn from the pilot study, right? You are having the hypothesis that whether, yes, what is your research idea, it will be true, or tomorrow it will not, right? So you will be having a hypothesis, or it will be having a null hypothesis, right? There will be some outcome, positive outcome for what you are looking for, or tomorrow it will not show that positive outcome, right? So for that, do some pilot study, right? Gain experience from that pilot study, learn from the challenges, what you experience while performing this pilot study, publish your results, take a patent, apply for funding, connect with different industries for further funding and to make it as a commercial product. Okay. So in near future, now this is a particular report of future jobs in India, 2022 perspective. So here you can see in near future, almost 9% of the, the researchers or the candidates, right, the employees will be deployed in the new jobs that do not exist today. That means the new jobs, the new, research areas, or, very different verticals will be coming in near future in the industry, where 9% of the students or the candidates, right, they are not aware of. 30% of existing employees, right, they will be deployed, right? They have to change their skill sets. 30% of these candidates, they have to adapt themselves. They have to learn new things which they have not learned in their previous job profile during their college time. Sorry. And 50%, 54% will fall under the unchanged job category. That means 54% of the students, the candidates, the employees, right, they will not change the job, even though they see that, yes, this is a good job for me, I will get a good career prospectus over here, I will get a good salary over here, but I'm not having that skill sets. That's why they will be unable to change the job, right? They will do the job what they are doing currently, right? And this number is 54. So only the option is that skilling and reskilling initiatives. So every day you have to reskill yourself. You have to adapt. You have to learn new things, right? And that is only the option. So here again, you can see, again, as per this report of the future jobs in India, a 2022 perspective, the major stake is taken by the artificial intelligence, the data analytics, IoT, that is Internet of Things. So being a pharma graduate, postgraduate, or a PhD holder, slowly somewhere you have to, adapt yourself to the technology. You have to, understand the basics of this technology, mainly the machine learnings, data analytics, and like that. Okay, some statistical understandings should be there. Okay, so I'm taking this opportunity to tell you all that Pure Foundation, we are celebrating a World Asthma Day competition, and we are inviting some new research concepts, research ideas, right, in the form of the thematic online presentations, oral research presentations, as well as your own ideas in the form of some educational videos, right? You can participate in this World Asthma online competition celebration, right? So first prize is around 8,000 and the second is around 5,000. So I look forward for the budding scientists and the researchers to come ahead and to contribute with your research ideas. Thank you. On behalf of my Pure Foundation, again, I thank the audience for your patient listening. Hope you understand something, about the basics of the research questions and the industry perspective. Thank you.
Thank you so much, sir. From our participants, if anyone is having any questions and the queries, you can unmute yourself and ask the questions. Till that, sir, we are having some questions on the YouTube. So
Okay.
one of the question is it possible to apply the artificial intelligence while working at molecular level during research?
Yes, definitely you can apply the artificial intelligence, but very first you need to understand what is the artificial intelligence. Yeah, so when we are saying that it is an artificial intelligence, you are talking about the machine learning algorithms. So what is a machine? Machine is nothing but your computer, right? It is some sort of a simplified form of the software, right? You know about some statistical tools, right? Like R, right? So I will say it is also a type of an machine learning, right? So where you are programming, you are designing some, a software like things, right? A program you are designing, right, with the help of the data. So when you're talking about the artificial intelligence, you need, large number of data. So data set is very important. Once you have a lot many number of the data, that data you can use to develop an algorithm. Now this algorithm, right, where your system is well trained, right, then only you can, use that particular machine learning algorithm to find out some solutions in the molecular research. So when you talk about the molecular research, right, I will say generation of huge number of the data is a big challenge, right? But researchers are working. Say, for example, here I will give an idea about some genetic analysis, right? Genetic data, right? So you can generate lot many information on the genetic profile. Now you can club this genetic profile, you can program it in a form of an algorithm, right, to find out the solution for your question, right? But yes, it is possible, but only the problem is that you have to generate, yes, huge number of data to implement the artificial intelligence concept in your molecular research.
Okay, thank you, sir. And one more question is there. Is there any certification course or the online courses, especially for the pharmacy students, for the training of the machine learning algorithm or for the development of the diagnostic kit?
Yes, you can go to Coursera, right? You can go to Coursera, and again, lot many free online courses are there on the Google. You can search it, but I will say directly enrolling for this type of the research courses, right? You should go through the basics of statistics, right? You can go through the basics of statistics, understand the statistical concepts very well, and then you can go for the statistical courses, right? So these statistical courses are the foundation of this machine learning algorithms, because when you talk about the machine learning, right, you're talking about some computational analysis, right? So it is a combination of your knowledge of computer science and the statistics. So you should have knowledge of both these domains, right? So directly, going for some short courses, free online courses, or directly going for this, some paid courses, I will suggest you to go through the basics of the computer science, go through the basics of the statistics, then enroll for these courses.
Okay, thank you, sir. One participant has raised their hand. You can unmute yourself and ask the question. Okay, sir. Till that, one more question is there. How can both asthma and the COPD treated together at the time by the diagnosis, and why the diagnosis is the only problem coming in it?
Yeah, what is the problem? As said, for the diagnosis of an asthma COPD, as of now, we are having some some sophisticated tools, right? Like spirometry. Okay. Now, these tools are expensive, right? Then operation of this spirometry, right? Or, performing the spirometry, right? With the patient is very difficult task, right? We have to train the particular technician that how to perform the spirometry. You have to train the patient as well, that how to exhale the air, how to inhale the air, how to blow into the spirometry, right? So this requires lot of coordination with the patients, right? So the major roadblock is the cost of the spirometry, and second is the well-trained technicians and a proper training to the patient, right? So this is the major roadblocks, right? That's why the diagnosis of the asthma and the COPD, they are, little bit difficult. But no doubt, new devices are coming in, right? Which will in future will take care of all these obstacles.
Okay, thank you, sir. I guess everyone has got the answers. Still, anyone is there to ask the question?
Just to add here,
Yes.
yes, thank you, sir. Very good session and is interactive also. As you mentioned that, so research output is always interaction is required. So might be at college level, Ambode sir already started, I think, journal club session, I think so. So that will might be helpful to the team coordination and innovative ideas for the research work.
Very true, very true. In our organization also, we are having, the journal club presentations, So in our peer group of the researchers also, we are conducting the journal clubs. So if you ask me at the college level, it is very, very important, right? You can start from your faculty members, right? And then you can percolate it amongst your students. So that should be the culture. Ideally, it should be the culture of the journal club.
Yes, sir, that sounds good.
Very important, very important.
Thank you, sir.
Yeah, thank you.
Okay, I guess everyone is done. So we can end this session over here. And really sincere thanks to you, sir, for giving the concern and your valuable time. We really appreciate your efforts, the way you began with the basics of the research, global burden of the disease in India, guiding the students how to move towards selecting the research topic and enlightening on the diagnosis of the disease. Once again, we appreciate your efforts to make this session really interesting. Thank you, sir.
Thank you. Thank you, one and all. Thank you.
Now we will move towards our second session of the day. I welcome Dr. Sujit Mishra, sir. It will be my honor to introduce him. Dr. Sujit Mishra is presently serving as Assistant Professor in the Department of Zoology, Centurion University of Technology and Management, Odisha, India. He has received his master's degree from the School of the Life Sciences, Sambalpur University, Odisha, in the year 2012 and the coveted gold medal from the Sambalpur University for securing the first position in the university PG examination. He received his PhD degree from the same university in 2020 and has been a recipient of the Inspire Fellowship during the tenure of his doctoral research. He has published many research papers in the reputed national and international journals. He has about 8 years of teaching and research experience. His focus area includes crop protection and molecular breeding and natural products and therapeutics. He has reviewed a number of papers as reviewer for a number of the national and international journals and serving as a life member of many national and international societies. I request sir to begin with his session. Over to you, sir.
Thank you, madam, for your nice introduction. I will be sharing the screen.
Yes, sir.
Is it visible?
Yes, sir, it's visible.
Okay, thank you. Honorable Chief Patron of this national webinar, Mr. S.T. Godawat, Mr. S.S. Godawat, esteemed Patron, Mr. V. Bhosale, Professor M.T. Telsang, Dr. N.K. Patil, and the convener of this national webinar, Dr. S. Ambavade, Dr. A. Patil, Dr. V. Gopade, all the invited speakers, delegates from different institutes, and the student participants. Wish you a very good morning and a good day too. Also, I would like to thank the organizing committee, particularly Dr. A. Patil, for inviting me to this national webinar on fundamental of research in pharma. Thank you, sir. As the topic suggested to me is basics of research, so I will be delivering my talk on this. So first, what is just a minute. So first, is it visible?
Yes, sir, it is visible, sir. You can continue.
Okay. So first, what is research? As you know, research is a combination of two terms, re and search. Re is a Latin term, which means doing something repeatedly, doing something again and again. And search means to try finding something. So research means finding something by doing the things again and again. And you know, many researchers, many philosophers, many thinkers have defined research in different way, but the purpose might be the same. The ultimate theme of the research will be the same. I say research is a systematic study on a particular subject matter to get benefit, to get comfort for human being and as a whole towards the living organisms in the living world. Here I will give one example. For example, suppose if we go back, if we think about decades ago, we'll be having hand fan, and that can be used by the people to get comfort during the summer. Gradually, people thought that the using hand fan require more labor. It will be here more effort has to be give, and gradually people thought about the electronic fans. Then later, again, from the electronic fan, they were not getting much comfort. And now we are using AC. So in this, what I meant to say here is, research is a never-ending process. As you know, human desires are never-ending. If one wants is fulfilled, if one demand is fulfilled, then we think about another. In the same way, in research also, it is a never-ending process. This will continue. Now, if we then this research is more than a set of skills. It is a way of thinking and examining critically the various aspects of our day-to-day work, understanding and formulating guiding principles that govern a particular procedure, developing and testing new theories that contribute to the advancement of practice and profession. And particularly in research, various kinds of questions arises, like what kind of questions, why, where, when, and how. What particularly denotes objective of the research, why denotes the purpose of the research, where denotes the circumstances, the situation, the condition, where research can be carried out, when denotes the time, and how denotes the method, particularly which can be used in the research. Specifically, the objective, purpose, and methods are very important components of research. In the mind of researchers, various kind of questions arises. Here I have cited some examples like, which is the most effective intervention for a particular problem? Suppose there is a problem, there is a social problem, and what will be the effective intervention for that particular problem? If we want to find the answer to these questions, we must carry out research. Another question is, what causes a particular phenomena or particular event? Suppose X is a phenomena, so what causes the X to happen? And what will be the effect? If X is formed, if something happened, then what will be the impact? What will be the effect of that towards the society, towards the community as a whole? Then what is the relationship? Suppose there are two events. What is the relationship between these two? In this way, many kinds of questions arises in the mind of researchers, and finding solution, finding answer to such questions can fulfill the underlying mechanism behind the research. Now, if we talk about the objective and purpose of research, as it seems like objective and purpose are alike, but objective and purpose are not same, not similar. There is a distinction between these two, but exactly saying the distinction is not so easy. It is a bit difficult. I say objective is something which can be used to acquire knowledge, and utilization of the knowledge for benefit. If the knowledge what acquired through our research objective, if utilized in a beneficial manner for the benefit of the people, then that fulfill the purpose of the research. Here you can see one example is given. A, B, and C are three individuals. Here the objective of A, B, and C are the same. Here A, B, C are three researchers, let's say. The objective of these three individuals are same, that is construction of a residential property. But if we go to their purpose, here's the purpose of A is the property, the construction is for its own. This individual is going to construct a house for its own living habitat. B is for letting. The building should be utilized in the rent purpose. And C has more money, C is more rich. So for capital investment, C is constructing the house. So you see here, the objective same, but the purposes are different. So what I mean to say here is, the objective of research, the objective of different researchers on a particular problem might be the same, but the purpose might be different. Here you can see there are four basic kind of purposes of research. First one is exploration, then description, then causal explanation, prediction. First, what is exploration? Exploration means knowing something new, finding out something new. which is not known to anybody. I will give one example. Suppose there is a plant species. The plant species is new, that is not nomenclature. Okay, so you are the person who identified that plant species for the first time, and being a pharmacist, being a pharmacy student, you want to know what are the phytochemical constituents there in the plant. Then for that you need to extract the constituents by using some extraction techniques. Different extraction techniques are there. You can follow the extraction techniques to extract different constituents. Then you can go for purification. Then you can go for structural elucidation. So in this way, finally, you are able to know what are the phytochemical constituents there in that new medicinal plant. So this is exploration. So this is one of the purpose of research. Another is description. Description means, suppose there is a event. Suppose I say you want to develop a new product. Is it clear? My voice is clear?
Yes, sir. You can continue, sir. No issue.
Okay. So suppose you want to develop a new product, pharmaceutical product. Then here, before developing the product, you should plan, you should think who are the potential buyer for this product. Who can really buy this product if this product will launch in the market? Whether the women can buy this product, whether the men can buy this product, or whether a particular age group of people can buy this product. So it has to be described, it has to be explained, and it is one of the purpose of research. Another is causal explanation. It is beyond description. I say, suppose in a community, a large size family, in a large size family, the death of child is more. Okay, the statement is like, in a large size family, the death rate of child is more. So here, if you want to explain the causal relationship, why in large size family more child die, if you come to a logical conclusion, then this is the causal explanation purpose of research. Now another one is prediction. Now best example, now the increasing trend of the COVID-19 pandemic is there. So by looking into the cases, corona cases, active cases in a particular state or in a particular country, by looking into the data of January, February, we can easily, by using some statistical tool, we can easily compute, we can easily estimate what will be the number of cases in May or June. So in this way, prediction can also be fulfilled by doing research. Then some of the very specific objectives, I have given some examples here. Provide solution to complex problems. If there is a complex social problems, then the objective of research can find solution for that problem. Then objective of research, investigate laws of nature. You know, there is various natural laws. Okay, and some philosophers, some scientists propose some principles with respect to this. Whether what they have proposed, that is now also hold good, that is now also that principles are followed, or something changes happened, or that might be misproved. So in this way, we can reinvestigate some laws of nature. We can discover new things, we can discover new products, we can discover new drugs. We can save cost. Suppose there is a product in the market and that is more cost effective. Most of the people, particularly from the lower middle class family or poor family, people not able to buy the product because of its high cost. So you want the same product, but will be having less cost. So cost can be reduced, cost cutting can be carried out by doing research. Similarly, to improve the life of human being, to fulfill the human desires, we can go for research. Now there are different characteristics of research. First thing is, the research originates with a question or problem. There must be a research question, there must be a research problem. If there is no question, if there is no problem, then it will be like you have no destination, you have not decided your destination yet, you are simply sitting in a vehicle. This will be like this. If you are doing research without a research questions or without a research problem, then if the research is not worthy, it is simply baseless. Then research requires a clear articulation of a goal. There must be a research goal. If there is no research goal, then also research cannot be carried out. Then it follows a specific plan of procedures. If for example, you already set a research goal, you have some objectives to reach to your research goal, then to work on the objectives, you must be having a specific plan. There must be having some sequential steps, some procedures, some protocols. So before doing research, once a research goal is set, then you properly plan for that, and accordingly you can work so that you can reach to your goal. Then if there is a very big problem, a complex problem, principal complex problem is there, research problem is there, then sometimes what happens, directly you cannot solve the research problem, but rather we can simplify, we can divide the problem into manageable sub problems, and one by one the sub problems can be solved, solution for the sub problem can be obtained, then ultimately the complex problem will solve. Then the research is guided by specific research problems, questions, or hypotheses. There must be research problem, there must be research questions, there must be hypothesis. What is hypothesis? It is simply a solution to the problem or research questions which must be tested. It is an answer to a research problem or research questions which must be tested. Okay, the research accepts a certain critical assumption. In research, we have to assume. Suppose we have set a research goal, we have some objectives to achieve that goal. Then here we must assume something. We must suppose what might be the outcome of the research. If I do this, then what ultimate result I will get. In this way, we should assume. Without assumptions, we cannot get the particular result. We may not get the result what we will assume. The result may be different, but at least we should suppose, we should assume what might be the outcome of the research. The research requires collection and interpretation of data in attempting to resolve the problem. So in every research, we get data. The data may be primary data, secondary data. There must be data. We can go for data analysis. Then we can go for interpretations, and ultimately we can get solution for the research problem. If we talk about the research process, there are various research process is a sequence of events carried out by different steps, different phases are there. First is identification and formulation of the research topic or problem. First is identification and formulation of the research topic or research problem. So if you want to do research, why you want to do research? There must be a problem. You may find the problem in your day-to-day life, maybe from your personal experience, maybe from your professional experience, maybe through media. You came to know something and you thought like there is no solution for that problem. So from all these sources, research problem come, particularly the research idea come, and thereafter the research idea, you should convert the research idea into a research problem. Now formulating the research problem. Why we should formulate research problem? The research problem allows the researcher to make clear what the purpose of your research is. If there is no problem, then you cannot able to know the purpose of the research. And it is very important for keeping the researcher on track with your research, whether the research is going in the direction which is formulated as objective or it is diverting from the objective. This can be tracked through research problem. And the research problem is a means by which research will be evaluated. Does the research address the problem as stated or not? This can be evaluated through research problem. Now, once there is research problem, then we can go for formulating research questions, hypotheses, and finally objectives. Particularly the research questions would be 1 or 2 questions. You should formulate 1 or 2 questions. If the questions will be more, then the project will be very big. Probably it would not be handled properly. So questions, research questions should be very a small one, maybe one question or two questions would be there. Then the questions should be very specific. It should not be generalized one. Okay, in our academic careers, starting from standard one, starting from primary level to secondary, then higher secondary, then undergraduate, postgraduate, PhD, doctorate degree. The curriculum is like an inverted pyramid. In standard one, we study many things, then gradually the things will be less, but depth of knowledge would be more. So in this way, here, if we are going to do research on a particular subject matter, then it should be very specific. We cannot come to a solution problem. If it is very specific, then we can easily get a solution for the problem. Now, next is research hypothesis. As I told, a hypothesis is a tentative answer to a research problem that can be tested. And developing hypothesis depends on two kinds of variable, independent variable and dependent variable. Now, what is the criteria for a good hypothesis? There are two basic criteria. The hypothesis is a statement about relationship between variables. As I told, there is independent and dependent variable. And the hypothesis carry clear implications for testing the tested relationship between the independent and dependent variable. Now, what is research objective? Research objective describe what we expect to achieve by a project. If we have planned for a research project, then what exactly we want to expect from that project? What we exactly expected to achieve, that can be defined by the research objective. Here you can see in this example, you can better understand these things by going through this example. There is a research problem, and the research problem is, will the time of year affect establishment when translocating a grassland community to a new site? Okay, this is the problem came in your mind. There is a grassland community in a particular location, in a particular geographical region, and you want to translocate that to a new site. Then what time of the year will be effective, that you want to know. That is your research problem here. Then from research problem to, if we go to research question, then the question will be like this: when is the best time of year to translocate a grassland community from its original site in Southeast England to a new site? Here, if you see, the problem is a generalized type. The question is a little bit specific. Here, Southeast England, the region is also given. Now, if you come to the research hypothesis, translocation of the grassland community in Southeast England is more successful if carried out in the autumn rather than in the spring. Now, you see your problem, your question, and research hypothesis. Here, the research hypothesis is giving answer to the research problem and question. But whether the autumn is best or rather or spring is best, to know this, we have to test this hypothesis. And for that, we can plan for objective. We can formulate the objective. Here, the objective is to determine whether spring or autumn is the best time for translocation of the grassland community in Southeast England. This is the objective. So in this way, you can, in any kind of research, in pharmaceutical research or in basic science research, whatever the research may be, in this way, you can formulate your research problem, questions, research hypothesis, and objective. Now, the next is research approach, design, and strategy. Once you formulate your research objectives, then you have to make a strategy. You have to design it. You have to go for research design. There must be a research design. There must be some strategy, some methodology, some methods, and accordingly you can work on your research objectives. If there will be no particular approach, if there is no design, if there is no strategy, then you might not carry out your research work properly. So there must be a research approach, design, and strategy. Then by following the research methodology methods, you can get some data. The data may be two types. One is primary, another is secondary data. And you can do research by taking both kind of data, primary data and secondary data. Primary data means, or primary, secondary, or both, mix up of primary and secondary. Primary data means when you are experimenting when you are experimenting on something and you are getting result of that, you are getting outcome from that experiment, that data is the primary data. But if you are dependent on others for the data, for example, you are getting data from a database, you are getting data from different research articles, then that data is secondary data. Okay, so either you can use primary data in your research, or you can use secondary data, or you can use both primary and secondary data in your research. So in this way, you can collect the data, you can gather the data before analyzing the data. The next step is data analysis. Here you can use different statistical softwares, different computational softwares, like statistical techniques like chi-square, correlation, regression, F-test, Z-test, T-test, different softwares like SPSS, R. So in this way, NTSS-PC, GeneLX, different computational softwares are also there. By using all these tools techniques, you can go for data analysis and thereafter interpretation of the data. Once you interpret, once you analyze the data, then the very next step is documentation. And documentation can be carried out. You can document, you can record your ultimate outcome in different way. Maybe you can publish a research article, maybe you can prepare a research project report, maybe you can write a thesis. Suppose it is a dissertation project work, then you can write a thesis. So in any form, you can document, you can record your ultimate outcome of your project. So these are some sequential steps must be followed in any kind of research. Already I told the steps. Now, basis of scientific research. There are various bases of scientific research. Here, most important I have cited. First one is reliability. Reliability means whether a research study can be repeatable or not. If it is repeatable, then it is reliable. If it is not repeatable, it is not reliable. And the reliable one usually can be followed by other researchers to advance this work to go forward. If it is not reliable, then it is not so effective. The next one is replication. Whether the methodology used in this research and whatever obtained by doing this research, that can be replicable or not. By following the same procedures, by following the same methodology, another researcher, a second researcher could repeat the study or not. That is replication. And this is also very important. Another one is validity. Validity means suppose I have developed a variety. Suppose a rice variety, disease resistant rice variety, a particular disease resistant rice variety, and that variety is developed in a particular geographical location in Odisha. Now, if I want to know whether this variety will be effective in other location of the country, let's say in Maharashtra, in a particular geographical location of Maharashtra, or in Gujarat, or in Tamil Nadu, then I have to grow that variety in different geographical locations. And if the result obtained, if the outcome will be the same in all the geographical locations, then it is validated. I say it is validated one. But if it is not, then it is not validated. So in this way, reliability, replication, and validity are very much important in scientific research. Now, of a good research. The purpose of research should be clearly defined. Whatever the concepts used in the research should be clearly defined. This is the basic criteria. Research procedures used should be described in sufficient detail to permit another researchers to repeat the research for further advancement. Then procedural design, whatever the research design strategies followed, be carefully planned to yield results that are as objective as possible. By looking into the objective, we can design our research, we can adopt some methodologies, some strategies which will fit our objectives of research. Then analysis of data should be sufficiently adequate to reveal its significance, and the methods of analysis used should be appropriate. Next criteria is the validity and reliability of the data should be checked carefully. And final one is Conclusions should be confined to those justified by the data of the research. Whatever data you will get from your research, the conclusions should be based on that. You should not conclude something beyond that. If you have no justified data, then you cannot conclude some other things. Now, a good research must be systematic, must be logical, must be that it must follow logical reasoning, it must be empirical, and it should be replicable. Now, if we talk about the classification of research, particularly based on purpose of research, the research can be of three kinds: basic research, applied research, and evaluative research. Basic research means, suppose there is a biochemical pathway occurring in our system, and that leads to a disease. If you want to know the mechanism of occurrence of that pathway, then here this is a basic kind of research. Means from the research, if the community, if the society is not directly benefited, that is basic research. If we are giving, it doesn't mean that basic research is not worth, because whatever contribution, whether a very small, whether a pilot work, whether a very preliminary work a researcher is doing, if it is reported, if it is published, then from that other researchers get benefit. So directly or indirectly, every kind of research every kind of research has a contribution towards the research community, towards the society. Okay, what happened in applied research? Applied research is otherwise known as action research or operational research. Here, the society, the people can directly get benefit. Let's take an example, the COVID-19. Now, COVID-19 is the pandemic is in an increasing trend. The cases are in an increasing trend. So we have no drug till today, and the vaccine is developed in a fast forward mode. So here, this kind of research, the vaccine development, the drug development, it is directly giving benefit to the society. So this is a kind of applied research. Product development, any kind of cosmetic product or pharmaceutical product, any drug development, that is a kind of applied research. Now, evaluative research. Evaluative research means this kind of research can be carried out to evaluate already developed policies, principles. Suppose take an example of midday meal in different states of our country. Midday meal program is going on. Suppose a researcher want to know the impact of this midday meal program, whether it has a positive impact on the students, whether it increase the enrollment rate of students, whether it increase the achievements, it enhance the achievements of the students. So in this way, if a researcher want to do research, then it is a kind of evaluative research. Now, come to the phases of research. Particularly, the phases of research can be divided into three phases. First one is planning phase, second one is execution phase, and third one is the documentation phase. And mostly in the planning phase, the mechanism of the project planning is a proposal. Here in the planning phase, mostly the proposal can be made with respect to the research, and the proposal must answer this kind of questions like: what will be done? Why is it an important thing to do? What are the objective and scope of the research work? And how will it be done? These questions must be answered in the proposal. And here I have given a simple outline of a typical research proposal. There must be introduction. First part is the introduction, and this includes a statement of the problem to be studied. Why is it an important thing to do? Why it must be studied? That must be there in the introduction part. Then there must be a clear and concise objectives of the research work. Then scope and limitation of the project proposal. Then preliminary survey of related work and literature. This is very much important. preliminary survey of the related research work must be, it is important. Why it is important? Because suppose you have a research idea and you have formulated some research objectives, you have a research problem. To know whether on that particular problem some other researchers are doing research or not, whether this problem is solved by some researcher or not. If this problem is undertaken by some researchers, then in which purpose the research is going on or it is carried out. To know all these things, you must go through different published research articles. You must go through different that is called review of literatures. You must go through different literatures. Then only from the literatures you will find a gap area with related to your problem, and you can work in that particular gap area. Suppose some researchers are doing on that particular problem, but there is a gap between what you are thinking and what they are doing. So in this particular gap area you may work. So that's why review of related literature is very much important. Next is proposed procedure. Based on your objectives, based on your project theme, you must use some procedures. Already some procedure would be there, published already developed procedure would be there, or you may develop new procedure for that. So proposed procedure should be there in the proposal. Then sources of data to be used, whether you can use primary data or second data, that must be there in the proposal. Then anticipated results or possible outcome, expected outcome, what outcome you are expecting from that project, that must you mention in the proposal. Then schedule of work by tasks, means suppose you have 3 objectives, so how much days, how much month or year the first objective will take, how much time the second objective will take, how much time the third objective will take. So in this way you can make a proper work plan. There must be a schedule of work. So these are some of the this is a typical proposal. The proposal, then another thing you must mention the budget for the proposal. How much budget is required? You must mention what are the instruments required. You must mention what are the instruments already you have in your laboratory, in your institute. You should mention. So in this way proposal can be prepared. Now the next phase is project phase, or that is otherwise known as execution phase. Here, based on your proposal, you can work by following the methodology, by following the strategy with respect to your objective, by emphasizing the objectives. The next is the documentation phase. In the documentation phase, you can record, you can this is here it is a write-off stage. You can write off whatever outcome you obtain from the research, from your project. And there are different kinds, different formats for this. Here one format I have given. In the beginning part you should mention the title page. The title page must be having your title of the project, the name of the investigator, then where the work is carried out, means your affiliation must be there. The next part is abstract. Next section is abstract. Abstract is a brief of your research. You can say a summary of your research, means what was the objective, what methodologies followed, what result particularly you should mention the result here, what result you obtained. Then keywords. The keyword ultimately reflect your research outcome. So you should give some keywords, like 5 to 6 keywords. Then table of content would be there, list of figures, list of tables. Then acknowledgement, if any research organization, any particular individual help in your research, then you should acknowledge. The next is introduction part. Here you can mention the statement of the problem, then hypothesis, why this research is important, objective of the work, scope of the work. All these things should be mentioned there. Then next is background and literature review. Whatever literature available with respect to your project, you should discuss all these related work and what is the gap area, you know from that. The next is procedure. You should describe the procedure used in the project, data used in the project, and how this data was obtained, you should mention. The next part is result part. Here you can indicate what happened and interpret what it means. Then next is discussion part. Whatever result we obtained, whether similar kind of result is obtained by some other people, means in the discussion part you should justify your result, what result you obtained, why you obtained that result. You may obtain your outcome based your expected outcome based result, you may not obtain that. If you may not obtain that, then you should write here, you should explain here why you have not obtained your outcome based result. If there is some human error or instrumental error, you must mention in the discussion part. If some researchers getting some different result, but you are getting some different result, then where they got some different result, why you obtained some other results, you should mention in the discussion part. Then finally, the conclusion and recommendations based on your data, based on your outcome of the research, based on your research findings, you can conclude, you can also recommend. So in this way, you can document your research outcome. Now here I have given a small overview of objectives, particularly in a phytopharmaceutical research. Suppose here one objective is phytochemical screening and profiling of the medicinal plants in a particular region. Okay, then another objective is there in silico analysis of the identified phytopharmaceuticals against the multi-drug resistant pathogenic bacteria causing infectious diseases. And next objective here is validation and efficacy analysis of the active bioactive compounds of the medicinal plant against the multi-drug resistant pathogenic bacteria. Suppose in this way 3 objectives have been proposed. Then for this, to achieve this objective, here I have given a brief outline of the methodology to be followed. First one is collection of medicinal plants. You can collect your desired medicinal plants. What medicinal plants can be used in this project? You can collect from different regions. Then you can go for extract preparation and purification of the phytoconstituents. Different extraction methods are there, like solvent extraction method, distillation, then succinate extraction, and purification techniques like you can follow here thin layer chromatography, column chromatography, or HPLC you can follow. Then morphophysical characterization and phytochemical screening of the plant parts and extract. You can go for same scanning electron microscopy. You can go for UV visible spectroscopy. You can go for phytochemical screening test. Then you can go for structural elucidation of the phytochemicals like FTIR, Raman spectroscopy, liquid or gas chromatography, mass spectrometry. Then you can go for NMR. So in this way, you can go for predicting the structures of your identified compound. Next is in silico analysis of phytochemical constituents against multi-drug resistant pathogenic bacteria. So here you can what happened exactly in pharmaceutical research, there is a requirement of ethical approval. Okay, and most of the institutes, I'm not talking exactly about the pharmaceutical institute, but most of the institutes, uh, uh, those are having basic courses, they are not having the approval, ethical approval. So in this case, what you need to do, you can go through molecular docking, through in silico analysis, through molecular docking, you can predict some compounds as that are having some effect towards a particular disease, towards a particular target. So here different procedures you should follow. You can predict the drug likeliness properties of the compounds. You can go for toxicity risk assessment of the compounds. You can go for molecular docking by taking a particular target receptor. You can use these compounds as ligand, and you can go for docking. Then you can go for molecular dynamic simulation, and ultimately, if you get best result, if you get a compound which follow all these steps, then you can go for in vitro study, and you can go for in vivo studies, and in this way you can develop a new drug. You can go for a new drug development. Now for this, I have mentioned here a work plan. Suppose first objective can be performed in 3 years. It is not actually like that. I have just mentioned for your understanding. The second objective will be fulfilled in 3rd and 4th year. Third objective will be fulfilled in 4th and 5th year, like this. Hope you the students you are getting some knowledge from this. Thank you.
Thank you, sir, for your nice presentation.
Thank you, sir. You're welcome.
Okay, so students, if you have any doubts, you can ask here, or you can just write it in the chat box or on the YouTube channel.
Friends, if you have any questions, you can ask.
Yes, students, you can just ask any question. Sir, there is one question from one of the student.
Yes, sir.
He is asking the importance of interdisciplinary research. So can you highlight it in short?
Yes. If you go for doing research in a particular subject, whatever I have mentioned in the methodology part, to study the animal, suppose you are using a animal model, mice model. Okay. So to study the animal behavior, you need a zoologist. If you want to go for drug formulation, you need a pharmacist. Okay, so in this way, if you do if you consider only one aspect, then you cannot ultimately reach to your target. You are a zoologist and you want to develop a drug for a particular disease, then you have no idea about the formulation of the drug, then you need to depend on a pharmacist. So in this way, multidisciplinary research helps in achieving our research goal. Without multidisciplinary research, it is difficult to, as my previous speaker told, if you sit in a corner of a room, if you have a no research team, then you cannot able to do research, you cannot get the expected outcome. So in this way, interdisciplinary research is very much important.
Okay, sir. It was a very nice presentation on the basics of research, and most of our delegates and students have got benefited by your talk. They understood how the importance of the research, specifically in the case of methodology of phytopharmaceutics, and how the basics are to be studied related to the phytochemical screening and in silico analysis. So thank you, sir, once again for your nice presentation and being the part of this webinar.
Thank you so much, sir. I am delighted to be a part of this. Thank you so much for your invitation. So I am on sharing the screen, sir.
Yes, sir. Okay, delegates. So there will be the break of 10 minutes. And after the break, we are going to talk with, or we'll have the session with one of the eminent person from the industry. That is Mr. Rajendra Wagmode, who is an industrialist person who is working as a manager in one of the reputed pharma industry. So we'll have the session with him. So we take the break for 10 minutes and again we'll join the session. Okay, thank you.
Okay, good afternoon, everyone. We are resuming here with our third session. It will be my honor to introduce our third guest, Mr. Rajendra Wagmore. Mr. Rajendra Wagmore is currently manager in the formulation and the development department at the Genvision Pharma LLP, Navi Mumbai. He has worked as an assistant manager at Cadlia Pharmaceuticals Limited, Ahmedabad, as an research associate at the Wokhard Research Center and Ajanta Pharma Limited. His research area is in formulation and the development of the liquid and lyophilized injectable products. Also, he is having his research area in the novel drug delivery system, liposomes, proteins and peptides, and ophthalmic preparations, solid dosage forms, and so on. He has pursued his B Pharm and M Pharm in the pharmaceutics from the Shivaji University, Kolhapur. He has organized and has been associated with various workshops and presentations. It is our honor to have you, sir, today here. Now I request you to start with your presentation. Over to you, sir.
Hello, am I audible?
Yes, sir.
Hi, good afternoon, everyone. I am Rajendra Wagmore. Today I will be delivering a webinar on formulation and development of the generic formulations. So just start with the terminology that what is mean by generic drug product, how it is developed for the regulated market. So generic drug is the product that is comparable to the innovator drug product in a dosage form, strength, route of administration, quality and efficacy, and its intended use. Generic drug can be marketed after patent exclusivity protection ends. So what do we mean by copy drug? The drug provided by a third-party manufacturer, despite the drug still it is patented. Then what do you mean by a substandard drug? The drug that is genuine, but it does not mean the meet the quality expectations. So due to differences in isomers, then impurities that may lead to lack of the therapeutic equivalence. So when and how do generic comes into the play? So as all of you know that the any patent that is filed, it has the exclusivity for the 20 years. So unless and until that patent is expired, you cannot market that product into the market before expiration of that patent. So if generic players come into the market, it will come after 20 years of the innovator patent expiration, because that yeah, so the next part is how the drug product development takes place in case of the innovator formulation. So the first step will be the clinical testing of the that formulation which innovator has developed. So in preclinical testing, there will be animal testing for toxicity and effectiveness of that particular moieties. Then second part will be the clinical study. So in clinical study, there will be phase 1 study, phase 2 study, and phase 3 study. So in case of the phase 1 study, it will be tested on very few volunteers, less than 100 volunteers, just to check whether the formulation is safe, or is there any kind of effectiveness is seen in the volunteers. To check that, phase 1 study is carried out. Then moving to the phase 2 study, that it will be carried out more than 100 volunteers and less than 1000 volunteers. So in that case, the toxicity and effectiveness and the safety of that formulation will be checked. Then moving to the phase 3 study, generally it is carried out in the 1000 volunteers to check whether the formulation is effective in comparison to the phase 1 and phase 2 study. Then after that, the next phase will be the regulatory approval phase, where all the data will be evaluated by the regulatory body, and the product will be approved for the market. And phase 4 study will be, that is the post marketing surveillance. So in that phase, the product will be in the market. In case any observational studies found or any adverse event observed, in that case the phase 4 will be come into picture. And but what in case of the generic formulation? So in generic formulations, there will be no pre-clinical testing, no clinical testing, and no phase for marketing, post-marketing surveillance, because all the data is already provided by the innovator. But what we need to do in our formulation, so the basic funda or the basic approach is the bioequivalence. That means our formulation should be bioequivalent with the innovator formulation. So all you know about the what do you mean by bioequivalence and how it works. So bioequivalence means your formulation should be pharmaceutical equivalence plus bioequivalence with the innovator formulation. So the basic or the what will be exemption for the generic formulator? Then there will be an exemption from the long and expensive phase 3 studies, because already the data is provided by the innovator for the phase 3 study. So what is the similarities and differences in the generic player and innovator formulation? So in this, what are the similarities? the same active ingredient, same strength, and same purity in both formulation. Then same pharmacokinetic and pharmacodynamic properties of the both formulations. Then same stability data for innovator as well as the generic player. Then same mechanism action, safety and efficacy. Then same therapeutic indication and route of administration for the innovator as well as generic player. So what differences will be allowed in the generic player? So you can use the different salt of the API for the formulating your drug product. Then you can choose different colors, flavors and preservative for formulating your product other than the innovator which he has used. Then you can choose the different size and shape of your tablet or capsule or the scoring other than the innovator. You can choose the different product expiration. For example, if innovator has a 24 months of shelf life, you can choose more than 24 months. Then you can choose the different manufacturing process. For example, innovator has used the wet granulation method. You can go by dry granulation method or whatever suitable method you can choose that that is allowed for your formulation. Then you can choose the different product name and packaging. Whatever innovator has used packaging material, you can choose the different packaging material, but by taking care that your product should be stable in that packaging materials. So what do you mean by pharmacokinetic and what do you mean by pharmacodynamic? So in generally biopharmaceutics, we already know that the pharmacokinetics mean what the body does to the drug, and pharmacodynamic that what drug does to the body. So what do you mean by bioavailability? That is the fraction or amount of administered drug that reaches to the systemic circulation. So the basic theory is that if you inject any drug directly into the IV administration by saline, so in that case, your drug reaches 100% to the systemic circulation. So in that case, you can say that your product is 100% bioavailable. But if you take the example of any oral administered drug, for example, tablet or capsule, so it has passed, it has to pass through the different GI phases, and then it will reach to the systemic circulation. So if you administer 100 mg of drug, probably 60 or 70% will be reached to the systemic circulation. So in that case, your formulation is the bioavailability of your formulation is the 70%. So it is determined by comparing the plasma level of drug after a particular route of administration with plasma drug levels achieved by the IV injection. So what are the factors that affect the bioavailability? So nature of the drug formulation, then chemical instability, solubility of the drug, and then first pass hepatic metabolism. What are the other factors that impact the bioavailability of your formulation? So that are the patient related factors, that meals timing, age, gender, disease, then genetic traits, GI physiology, and some other factor. So what do you mean by bioequivalence? The two related drugs are bioequivalent if they show the comparable bioavailability and similar time to achieve peak blood concentrations. So bioequivalent products can be substituted for each other without any adjustment in dose or other administrative therapeutic. Then if you see this graph, you can you doubtfully clear about the how bioequivalence play. So three factors will be in the bioequivalence, that is Cmax, Tmax, and AUC. So if you check the red graph, that is the innovator how it acts. The blue line with generic formulation. So your Cmax, that is the maximum drug concentration, then Tmax, that is the time required to the maximum concentration, and the AUC, that is the total drug under the plasma concentration time curve. So it should be matched with the innovator, then your formulation is the bioequivalent. So just see above this image. So branded drug product, it is in the 90% confidence interval of the ratios of AUC, Cmax and Tmax fall between 80 to 120%. So branded drug is between the 80 to 125%. So your generic drug product is non-equivalent if it falls below the 80%. So just see that it is below the 80%, and also it is non-equivalent if it is drug product it above the 125%. So when it is bioequivalent, when it will be bioequivalent when it is between the 80 to 1.
गौरी तो वर गेला टाकी काय ते त्याला
So normally, how this generic development is carried out. So the basic is basic start with the literature search. So how this literature search start this? So you can go through the Orange Book. So then the US FDA sites that drugs at FDA. Then you can go to the various patent site, that is USPTO or European patent site. So where you will get the enough information about the innovator formulation. So what are the information you will get from the Orange Book? So in an Orange Book, you will get the information about the what are the drug products approved by the US FDA. So in that case, there are different tabs where you can search what are the formulations are approved by the USFDA. So how you can search that? So there are different tabs. You can search it by the name of your active pharmaceutical ingredient, that is API. You can search by the company name. If you have the name of the innovator formulation, so you can check by the name of that innovator formulations. And if you have the information about the patent number, you can directly search by putting the directly a patent number. You will get enough information about the patents. So what information you will get from the drugs at FDA side? So where there you will get the labeling and reviews of the innovator formulation. So in case of the label, you will get proper information about the innovator formulations, what he has done, how he has performed various studies, and what were the outcome of that individual studies. So moving to the next part, that is the T code, that is therapeutic equivalence code. So if you go through the Orange Book site, you will get the information about the therapeutic equivalent. So there are mentioned, that is AA or AN that in the Orange Book. So that means there are no suspected bioequivalence problems in the that formulations. Then next you will find that various NDC code, that is it is shown on the innovator formulation, or that directly on the pack size of that innovator. So what is the NDC code? That NDC code is the National Drug Code. So it is given by the FDA to identify the typical that formulations. Then summary basis of approval. So what are the information if you get from the summary basis of approval? That it shows in that clinical pharmacology and biopharmaceutics review of the innovator formulation. Then what are the biorecommendations has given by the FDA? Then what is the formula of the innovator and what is the manufacturing process he has done? Then what are the API characteristics innovator has used? Then dissolution media, that what dissolution media is suitable for that particular formulation. Then if it is the tablet formulation, what is the compression parameter for that formulation? Then what are the labeling recommendations, and what is the stability requirement? So stability requirement should be as per the ICH. So if you go through the ICH, you will get the enough information about the ICH and ICH guidelines. So what are the long-term conditions, what are the accelerated conditions, everything you will get from that guideline. Then there are different types of exclusivity given by the FDA to the any formulator. So what are the types of exclusivity? First one is the orphan drug exclusivity. That is it is for the 7 year. So it is given by the FDA upon approval of the designated orphan drug. So if you file any drug product as the orphan drug product, you will get the 7 year of exclusivity. So in that 7 year, there will not be any competitor for your formulation. You will be the only one in the market to market that product. Then next one is the new chemical entity, that is NCE. If you file the if you get the NCE exclusivity, then there will be only one product in the market for that 5 years. Then other type of exclusivity that are mentioned for the 3 years. So in significant change, you will get the 3 years of exclusivity to market your formulation. Then what type of patents are listed in the Orange Book? So patents are listed for the active ingredients, then formulation composition, and some patents are listed for the any kind of indication or method of use of that product. So what are the filing parameters? First one is the para 1 type of filing for the patent. So in that case, the such patent information has not filed. So this is the first one patent, that is para 1. Para 2, that patent is already expired. You can file after the in that once innovator formulation is expired, you can file the para 2 approach. Then para 3 is that the date on which innovator patent expire, you can file your formulation. And last one is the para 4. So para 4 is the patent, that is you can challenge the innovator patent, or you can non-infringe the innovator formulation, and you can market the product. Then next one will be the how you will source the API for your formulation. So there are different requirement to purchase the API or source your API. So 3 or 4 requirement are that your API shall be USP or EP monograph compliant. So what is the then the impurity profile and the stability shall be enough so that you can procure that. Then the DMF should be available to procure or purchase that API, and that patent non-infringement statement should be in there, so that you can that the innovator cannot suit you if you do the infringement of that innovator API. Then we carry out the pre-formulation study. So in pre-formulation study, basically we carry out the post-degradation study. So there are 4 to 5 factors come into picture in case of the post-degradation studies. First one is the heat study. Second is one is the humidity. Third one is the acid hydrolysis. Fourth one is the base hydrolysis. Then next one will be the oxidation studies, and last one will be the photostability study. So this study will be carried out to check that whether your product is stable in all these stress factors or not. So based on that, your formulation strategy will be decided. So once you get the information or receive the innovator product, the chemical testing and physical testing of the innovator formulation will be carried out. So in case of the physical testing, the tablet or capsule size and shape will be determined. Then tablet color, that code of punch, and the pack size of the innovator container will be carried out. Then what is the container and closure system he has used will be analyzed. Then what is the weight, then what is the thickness and hardness of the innovator formulation will be carried out. Then what is the LOD, that is loss on drying of the innovator formulation, will be checked. Then friability, disintegration, that is DT, and dissolution sorry, dissolution study will be carried out for the innovator formulation. Then how will you check what is the innovator formula? On what basis you will find out that? So in that case, you have to search the different sites with the FDA site, FOI. Then innovator product label, you have to search that what is he has mentioned in the formulation. And then microscopic observation, in that the particle size of the innovator formulation. Then what is the crystal shape, crystal habit. Then what are the excipient he has used. Then what is the soluble fraction and what is the insoluble fraction. he has used, you have to determine. Then next chapter will be the formula optimization. So in that case, you have to optimize your granulation time, then speed of choppers or mixer blades, then solvent addition rate, and size of the intergranular and extragranular disintegrant or binders. Then screen size of the milling, that is sieve size, you have to optimize in the granulation. Then in case of the drying, that is the drying temperature versus target LOD, you have to optimize. Then in case of the blending, that blending times, then lubrication time, you have to optimize. And lastly, that is the compression. So what is the hardness, and what is the hardness range, you have to optimize in that case. Then next one will be the F1 and F2, that is similarity factor and dissimilarity factor. So you have to match your F1 and F2 with the innovator formulation. Once your F1 and F2 is matches with the innovator formulation, you can go for the bioequivalence study. And once your bioequivalence studies passes, then you can go for the technology transfer. Then what are the stability study guidelines, or what are the stability study requirements for the US market and Europe market? So for the US market, that long-term study will be the 25 degrees Celsius temperature and 60% RH will be the long-term condition. And intermediate condition will be the 30 degrees Celsius temperature and 65% RH. And the accelerated condition will be the 40 degrees Celsius temperature and 75% RH. So what will be the sampling time points or testing time points? So in case of the long-term condition, you have to test the drug product at 3 months, 6 months, 9 months, and 12 months for initial for first 1 year. Then for next year, you have to test the drug product at 6 month interval. You have to test the drug product at the yearly. So the condition will be 3 months, 6 months, 9 months, 12 months, 18 months, 24 months, and then 36 months. While in case of the accelerated condition, you have to test the drug product at 1 month, 2 month, 3 month, and 6 month condition. While in case of the intermediate condition, you have to test the drug product at 3 months, 6 months, 9 months, and 12 months. Then in case of this is the condition when your drug product is stable at room temperature. But when your drug product is unstable at room temperature, and it is mentioned that drug product to be stored at 2 to 8 degrees Celsius, then the long-term condition will be the 2 to 8 degrees Celsius, and the accelerated condition will be there 25-60. And once it is done with the F1, F2 matching and the bioequivalence study passes, then you have to file the drug product with the regulatory bodies. So the regulatory body will audit your everything data, and your if it passes or the data is okay with respect to the innovator formulation, then you get the approval for your drug product. Yeah, I'm done with the presentation.
Okay, thank you, sir. Participants, if there are any queries and the questions, you can raise in the chat box, or you can unmute yourself and ask the questions. Till that, sir, we are having one question that what is Orange Book?
Okay. So Orange Book is the digital platform where you will get the approved drug product with the therapeutic equivalence evaluation. So if you check the this tab, just look at here. So this is the Orange Book information where the approved drug product are mentioned in this site. So what are the patents related with this? You will get information on the Orange Book. So I have mentioned this remdesivir injection in this site. So he has got the approval in October 2020 for this market. Sorry, this product. And if you check the patent and exclusivity information, you will get that information that below are the patents filed by the innovator, and this is the patent expiration. So the last patent expiration date is the 2038. So before that 2038, you won't be market that product unless and until if you have permission for the innovator company.
Okay, sir. Any other questions from the participants?
So there is one question which is asked by one of the student from final year, I think from different. Okay, his question is how the industrial life is different from the college days. So it is a basic query which is most of the time students ask that how the industrial life is totally different. So can you elaborate in short, sir?
Yeah, with respect to the industrial life, actually, in industry, their target and their product are different with respect to the academic life, because in academic we mostly focuses on the theoretical approach, and while in case with respect to industry we majorly focus on the practical work. So mostly we have to do the practical work in the lab with respect to the industry, and because the motive is to develop that product in the very short period of time, and we have to market that product. So this is totally different with respect to the academic and industrial.
Okay, sir. Thank you. Any other queries? Sir, are there any questions on the YouTube?
No, madam.
Okay, so then we can end this session over here. Thank you, sir, for your time, for your valuable time, and elaborating all such important points in such a limited period. And once again, thank you. We are grateful to have you, sir, on this
Okay, thank
webinar.
you very much.
Now we will have the general question and answer session where all the participants can ask any questions for all the speakers which were there. So you can have the question answers for any of them. Participants?
So all the delegates and students, this is an open dice to you. So you can ask any questions related session with the guest speaker today here and with the different students. from the different universities and colleges. So this is an open dice to all the students and delegates. So you can share your questions.
Hello, sir.
Yes.
Sir, can we have a mini course work for the research?
Okay. Delegates, that how many of you are interested in some mini coursework related to the research? Suppose if we plan for such thing, so I just want to know, as an inquisitive mind, that how many of you are interested. You can raise your hands. Great to know that. I'm totally delighted that many of the students are interested in some short coursework related to the research, and we'll have the discussion this with our team members, and we'll let you know that in coming days you will get some kind of a package, or rather a small coursework, which will be designed by the expert teams, and hopefully will include you all students or the interested students in that, and we'll see what can be done. Okay, thank you. So that was a nice question from one of the delegates. Okay, any other question you can ask here.
Hello, sir. You are listening?
Yes.
Yes. My question for the Dr. Srikant Pawar, sir.
Yes, sir.
My question for the Srikant Pawar, sir. Dr. Srikant Pawar, sir.
Yes, you can ask.
Sir, I was been developing a critical asthma model in rats, but problem was arising that it cannot mimics the human phenotypic asthmatic symptoms in rats, right? In rats, right? But I tracked the neurological pathway of by installation of intratracheal dose of sensitized allergen that gives the activation of prime sensitized dendritic cells to give asthmatic symptoms that in earlier period, which takes 1 month to 1.45 months. I managed it within 15 days, but there are still problems are there. So you can suggest something that can useful for me for the development more asthmatic model that exactly mimics the phenotypic asthmatic model. Because drug showing in preclinical asthma consistent drugs inconsistent in preclinical asthma model that are not addressing same on a phenotypic asthmatic symptoms. in humans.
Okay, sir, your question is taken into the account. I think due to some network issue, sir is not available here, but your question is taken into the account, and the answer for the same, it will be just posted in the group which is created, or rather it will be available on the YouTube. Thank you, sir. Okay, any other questions from the delegates?
चुप बेटा 2 मिनट.
Okay, any delegates, if you want to ask the question, you can mute the microphone and you can just ask.
Okay, Mansi, your question is what is molecular docking? See, if you want to develop a drug, am I audible?
Yes, sir, you are audible, sir.
If you want to develop a drug, then directly you cannot develop a drug by testing. Suppose you are thinking that a compound is having a drug-like property for a drug for a disease. So here that drug you cannot directly use that drug in an animal model to study whether it is effective or not. Before that, why you cannot use the animal model? Because unnecessarily we cannot kill the animal. So before that you can use the same thing by using molecular docking approach. Here what you do, you can take the receptor means it is a protein or an enzyme, whatever may be. So ultimately what happened, when there will be a ligand, what is your proposed drug, if that will interact with the target receptors. So let's talk about COVID-19. There are different, suppose spike protein. Suppose if we target the spike protein, usually bind to the SCE2 receptor of human being and it enters to the human body. So if we either block the SCE2 or we block the spike protein, then it cannot enter to the human body. So here we can test some drug-like compounds of some compounds against the receptor. If we get a proper interaction, if we get a good binding energy, then you can further go for molecular dynamic simulation to check the stability of the interaction. Okay, so in this way, finally, we can, through molecular docking by computational approach without doing any wet lab, through dry lab, we can screen some drug that will be having the potential drug likely compound against a disease. And thereafter, you can go for animal model study or any in vitro study to know whether that is effective or not. So in this way, molecular docking can be used in particular drug discovery. Hope you got the answer.
Yes, sir.
Okay, thank you.
Okay, any other questions from delegates? Okay, so if there are no any questions, so uh, we'll end the session with a vote of thanks. So it was a great privilege to address, or it is a great honor to have asked to offer a vote of thanks on the occasion of this two-day national level webinar on fundamentals of research in pharma. I remark a proficient sense of gratefulness to Chief Patron, Honorable Shri Sanjayji Ghodawat and Honorable Shri Shrenikji Ghodawat, and our patron, Shri Vinayak Bhosle Sir, Trustee, and Vice Chancellor, Professor Dr. Martin Tilsung Sir, and Registrar, Dr. N.K. Patil Sir. I am thankful to our Dean, Dr. Ambodekar Sir, from the School of Pharmaceutical Sciences, who is the key person to organize this two-day national webinar. Special thanks to Dr. Vishwajit Kurpade Sir, co-convener, and Shri T.S. Jangam Sir, Deputy Registrar. I want to extend my generous thanks to our respective speakers of 2 days. Within these 2 days, we learned many aspects related to the research. On the day one, the speaker were Dr. S.D. Ambodekar Sir, who talked on the importance of research, how to start the research and its types. He gave ideation that be like a child with inquisitive mind to look at issues. And for that, he has quoted one beautiful image of a child holding a laptop. It was a great privilege to address the webinar for the day one, and there was my talk. I focused on the importance of research in cancer and its basic strategies like how, what, when. These questions are important in the research, so never stop asking the questions. Next speaker for the day one were Dr. Vishwajit Ghorpade sir, who talked on the basics of research and highlighted the importance of publication in time. He also talked on importance of IPR in brief with its impact on the society. So it was a great talk given by Dr. Ghorpade sir related to the basics of research and its importance. The day two started with the talk of Dr. Shrikant Pawar sir, who focused on industrial perspectives of research. He has beautifully expressed the receptor concept by lock and key model, which was given during his presentation. Sir, after a long time, we have came across this mosaic sandwich and receptor activity model because we have seen this at in our college days. Thank you, sir. He also motivated students that everyone can do research by giving the example of Susie Mazan and her issue with the asthma and how we came with an ideation of hair spray dryer and its correlation with the drug delivery. Second talk was given by Dr. Sujit Kumar Mishra sir, who talked on the basics of research, its methodology of phytopharmaceutics. He focused on the phytochemical screening with in silico analysis. His talk motivated the students related to the basics of research and ideation. The third talk was given by Mr. Rajendra Wagmode sir, who talked on the generic drugs and phases of drug development and its approval process. He gave idea to all students that why the vaccines of corona came after a year, because he emphasized on the basics related of preclinical trials, clinical trials, and its different steps. He also emphasized on generic formulations, that is general guidelines, with special talk on Orange Book. I take this occurrence to thank the entire committee of this two-day national webinar from the School of Pharmaceutical Sciences, Sanjay Ghodawat University. I just want to give special thank to Miss Sonali Nirankari Madam for the nice coordination during these two-day sessions. And also thank to Miss Bhagyashri Ghate Ma'am, Miss Pranoti Patil, Miss Vanzari Madam, and all teaching faculty of School of Pharmaceutical Sciences, Sanjay Ghodawat University. Special heartfelt thanks to all delegates from different colleges and universities for being the part of this national webinar. So, as per the suggestion given by students that they are interested to be the part of a coursework, a small coursework where they can get idea that how the research can be conducted. So we are going to think on that aspects, and as soon as possible, if we come with some idea, then surely it will be shared with the students. So I believe that you all delegates enjoyed the session of the webinars for the 2 days, and I thank you for being the part of this. Over to you, Sonali ma'am.
Okay, thank you, sir. I request all the delegates to do not leave any WhatsApp group unless and until you are filling the feedback form. Once you are submitting it, after that you can leave the groups. Uh, I would like to declare that we have completed with the second day of the webinar also successfully. And thank you all the speakers for your coordination and your time for spending such a valuable time over here. Now, I would declare that this program is over and everyone can leave now.